every good research lies an ethics committee. A good research is one that is scientifically and ethically sound. All interventions, treatments, and drugs must undergo series of rigorous and meaningful research to determine its efficacy and effectiveness in treating diseases. The Independent Ethics Committee, or Institutional Review Board, plays an important role in reviewing studies to ensure the protection of human participants is in place for every research. UMMC MREC is an independent committee composed of medical professionals, legal expert, non-medical personnel, and public members. Its responsibility is to scrutinize the ethical concerns in medical research protocol involving human subjects, to provide public assurance, and ensure the safety, welfare, and rights of subjects. The review process of UMMC MREC is rigorous yet timely. Aside from that, the safety and efficacy of the products will also be monitored by the Ethics Committee throughout the entire development phases. We, in UMMC MREC, strive for the human subject protection in medical research.
Backdrop, yeah? Which one is the first slide? First slide, which one? The first slide, which one?
I already opened all. This one will be the first
First slide. Tengku, right? Hello everyone and very good morning. Welcome back to our Health Academia Month and Research Carnival 2023. We have successfully completed 4 fabulous days of the Research Carnival and have finally come to the last day of the Research Carnival. And first of all, we would like to thank all wonderful presenters and audience who joined to make this event fruitful. And it was, as the previous initiative of the 4 days has set the audience expectations bar really high, and that as the audience expectation bar really high and set the audience programs aligned for the final indefinitely one of the kind, and surely worth to wait. Just as the previous day, we have one audience to expand their rational horizons simply by just being seated here and listen to them. So without further ado, let's kickstart our day with our first sessions on mobility program. Our first speaker for the day would be Associate Professor Dr. Tengku Hamad Sharizin bin Tengku Dato Homar, the Deputy Dean of the Student Affairs Office. Dr. Hamad Sharizil is a otorhinolaryngologist and head and neck surgeon, specialized in rhinology and endoscopic, sinus and anterior skull-based surgery. He graduated with his medical degree from the University of Sheffield, his master's from University Malaya, and underwent further training in New York University Langone Medical Center. Besides being a Deputy Dean of the Student Affairs in the Faculty of Medicine, University Malaya, he also chairs the Task Force Facilities for Jawatan Kuasa Pelaksana UMHMC, Health Management Committee. His previous leadership positions include being Interim Medical Director of University Malaya Specialist Center. With that, I would like to cordially invite Associate Professor Dr. Tengku Hamad Sharizil to present his talk on the introduction of the mobility program in the Faculty of Medicine, University of Malaya. Thank you.
Assalamualaikum warahmatullahi wabarakatuh and good morning. Thank you so much for your kind introduction. And okay, I'm Sharizal. I'm currently the Deputy Dean of Student Affairs, and really looking forward to be listening to our next two speakers, Dr. Tamil Selvi and Miss Ilias' experiences, and it's a shame that I have to start the morning with something very dry and and sterile, but I shall make it swift and painless as possible. Okay, so but this since it's about mobility, so I've somebody's got to do the dirty job of going through the boring bits. Okay, so first of all, I would just like to have a mention about the UM's Global Enrichment and Mobility Division, which is shortened as GEM. So this is division in UM which handles all mobility matters, and the division resides under the Associate Vice Chancellor of Global Engagement Office. Currently is Prof. Yvonne Lim. And so they handle all student mobility applications, admissions, and designs, and organizing short-term programs, and they also handle data and handles all this data and submit them to all the appropriate authorities. But so they pretty much handle almost the whole university. The whole university's mobility exercises, but there are a few faculties which handles their own, and we are one of those. With the Faculty of Medicine, Faculty of Dentistry, and Faculty of Pharmacy, and Institute Asia Europe. So these are the faculties which handle their own mobility. But of course, we have to submit them to submit all the data to GEM anyway, because GEM will be liaising with all the authorities to assimilate all this data for the whole of UM. So since we are one of the more independent faculties, so I would just like to introduce FOM's mobility program team. I have 3 people who are helping me out. That's the one. The first one is the Assistant Registrar of Student Affairs, Ms. Ainul Munira, and then Madam Sapya Sarip and Mr. Kuhan Krishnan. It's not a big team, but we have to handle quite a big load of in inbound and outbound works. So it's quite a heavily taxed team here. So going to mobility programs, we have inbound, we have outbound. So basically, inbound is pretty much what it says. Students internationally coming to UM, and you can divide the attachment into short term and long term ones. And I won't go into the details now with these slides, but I just quickly run through. And of course, we have the outbound ones, and with MOHE has their own operational definition of what counts as mobility, and this OD is being applied. This is what GEM and hence UM is also abiding by this definition. So it's quite a mouthful there. So I'll just fast forward to the next slide, which is summarizing it. So basically, the keywords that I need that we need to take note is a mobility program. It has to be first an academic program, and it's organized by an HEI, the short abbreviation from a higher education institution, and it has to be crossing international borders, so involving international movement of inbound and outbound of undergraduate and postgraduate students, and is attended face-to-face or hybrid. So, there has been some modifications to the definition of mobility, because previously we do not count postgraduate somewhat similar exercises, but now postgraduate students going through the same thing is counted as a mobility exercise, and and of course when COVID came, when COVID left, COVID came and left, but the world's changed, and some of the things I think one of the more positive thing is the ability to engage online. I mean, and not everything needs to be face to face. If some things can be done online with great savings of times and expenses. So the programs can it has to be face to face and or hybrid. But hybrid here means that if you take the whole program, not the entire program is done online. So some of it will have to be, a good proportion of it has to be still face to face in physical presence, but with a mixture of some online, so that's considered accepted. So we can divide the programs into short-term programs and long-term programs. Okay, and so basically, short-term program is any program which is less than 3 months, and when it comes to minimum, it can even go to as short as 1 day and even to minimum of 4 hours cumulatively. And yeah, it's cumulative, so it doesn't have to be one shot. So, and for long-term program, anything more than 3 months to 12 months. So basically, now the definition of operational definition of mobility has widened a bit, so to enable more of our exercises to be counted as a mobility attachment and exercise. So what we traditionally and what we have gotten used to previously were clinical electives. What our medical students go through. They go to Nottingham or to some of the country, and we have overseas students coming here, the medical students. But I would just like to I will also highlight this later, that it's not only clinical. I mean, you can have research electives, and in fact, I mean, if you have any academic, as long as the content, there's an academic content in your courses, seminars, workshops, and it does have all these criteria, it can be counted as a mobility exercise. So usually when we have workshops, we don't count that as mobility, but now we can. So that's why we have elected mobility coordinators, and to update everyone on all these new updates, so that now we can have a more a tighter and more proper data collection. Yeah? And of course, what I defined just now was the MOHE's operational definition of mobility, which is adopted by the university and hence GEM. But I would just like to make aware to everyone that every single authority, ranking or database or system database may have different criteria. So this is not something for you to go deep into the detail, but just to show you that there'll be differences in terms of their own operational definition. So we have, like, as example, my MOHE's QS and THE and Setara, so they have their own definition, and GEM will go through all this and see which ones is abiding to any of this criteria and submit it to the appropriate authority. So there have been some difficulty to assimilate about categories of duration, and this is not by just everyone, but also for us, for the mobility team in the faculty, because with it being an international exercise, when we're dealing with inbound students coming in, the immigration regulations the immigration regulations have to impart the regulations upon the durations, and these durations of how long a student can be around as a visitor differs between countries. So in some countries, the maximum duration that you can be here in Malaysia is limited to 1 month, and in some countries it's 3 months. So when we receive applications, and when we have certain courses, which certain attachments which are ready to be receiving students, we also have to check on from which country the students is arriving. So because this dictates whether they fall under the 1 month or the 3 month category. So, but say if we take like somebody from Singapore, so Singapore the maximum is 1 month for one month attachment. Sorry, 1 month when you can enter the country as a visitor pass. So to keep things simple, they just come as a visitor pass. On a visitor pass, and they can undergo the electives. So, and for students who come from countries where they allowed up to 3 months, so they can come here for like 6 weeks or 8 weeks, and and not have to register for the student pass. But anything more than 3 months, definitely you have to you have to go through more bureaucratic levels in order to get the student pass, and it has a more elaborate steps and a lot of working with. This is the link with which you can click to go to the current website, which has the details on mobility. Okay, we are still in the process of updating the website, the content. I mean, we're working hard to update it to the latest definitions and everything, and to the latest needs as a result from our feedback from students. And as you can see, even the link itself is still calling it elective postings. It's not wrong, but the old word is elective, and we want to be standardized as mobility. So, but this will change as we keep on updating it, and we will keep you posted when the new fully updated website is there. But the current one is still there. Yeah? So it is. Even though it may not be to our desired stage yet, but it does have pretty much almost everything that you need for now. And so in essence, for students, for university level students, we can divide the postings into clinical and research attachments. Research attachments. So these are, I won't go into detail, but these are this is a list of all the departments which are offering clinical mobility attachments, and with the associated fees. And for the interest of the operational definition of mobility, I think we will be concentrating on for international students. So administration fee is standard 400, and the attachment fee is at the rate of 1.5 a month. So all these fees are not decided by the faculty, but we have University Malaya's JYU, the fees committee. They have a standard fee schedule by which the whole university and all the faculties have to abide to. And we also have research attachments, so which are not clinical, and these are not only limited to non-clinical departments, as students may come into a clinical department but come for a research attachment. So the departments which offer this are still the same as a clinical elective posting, but of course it's extended to non-clinical departments as well. And looking at the international, the fees imposed on international students, so we can see that the administration fee is standard 400 ringgit, approximately 96 US dollars, but this will fluctuate according to alarming exchange rate, which is occurring now. So it will fluctuate, but roughly that's about the amount for administration fee for all kinds of attachments. But just repeating myself again, as you can see in the second row, for clinical science, for clinical attachment is 1.5k Malaysian ringgit, and for science, for research attachments, it will be 1.2k. The non-science may not be relevant for our faculty, but I just put it here anyway. And just to make you aware, since we have since I think many of you will be the mobility coordinators for your department. So instead of in addition to the traditional mobility attachments, we have started a new category, which we call the shadowing program. So this is open to students who are in the pre-university stage. So these are not university students. These are not higher education institution students. So these are for students who want to have a short stint, and the word shadowing is an important keyword here, because they are not to be left alone. So they will have to be shadowing their supervisors at all times. And so basically, in essence, they come here as purely an observer, and then they don't have independence to be alone, unlike the university students who come here. And especially in the clinical setting, they're not to be involved in any clinical activities or in anything which will have an impact on patient management. And as I have mentioned earlier, so this is open to allow pre-university students, as an example of A-level students, STPM, SPM, and equivalent, age above 18. And we divided it into two short durations, whether it can be 1 to 3 days or 4 to 5 days, and there is the fee schedule there for the different durations. So just to wrap it up, shadowing is purely an observer exercise, and but with the student coming to shadow the academician, either in a clinical or non-clinical setting, they will get a good taste of what that line of career entails, rather than just read about it and hear second-hand stories. Now they get to be hands-on. Well, not really hands-on, but they get to be there to see how the academicians handles their daily activities in their career hands-on, and it exposes them to a lot of valuable observations that can help them in making their career choices and university courses choices after that. So that's it. My very dry and sterile presentation for this morning, but at least you know the basics in and outs of what is the mobility program as in UM. So thank you for your attention, and you're welcome to ask any questions, or maybe since we're doing this in the forum setting, maybe we can kumpul together all the questions towards the end. You're free to do so at any stage. So thank you very much, and I look forward to our next two speakers, and I'm very excited to hear them to share their valuable experiences with us. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good morning.
Thank you so much, Dr. Ahmad. Sorry. Okay. Thank you so much, Doctor. So, right, our next speaker would be Dr. Thamil Selvi Ramasamy. Dr. Thamil Selvi Ramasamy is from Department of Molecular Medicine. She has earned her PhD in Clinical Medicine Research Program, specialization in human embryonic stem cell research from Imperial College, London, UK. She is currently heading the Stem Cell Research Laboratory and her research team conduct innovative and cutting-edge research in developing effective stem cell therapy for degenerative diseases and precision medicine for targeting cancer stem cells. Her passion in bringing the impact of research and innovation to a great height is very much evident through many leadership roles that she held in the past years. Among the most recent are her contribution as the advisor to Minister of Science, Technology and Innovation, Musti, followed by Special Officer to Minister of Health during the pandemic. It is noteworthy that Dr. Sylvie and Associate Professor Andri, Faculty of Engineering UM, are the joint recipient of Grand Award to chair the 2022 AUA Overseas Study Program. Thus, we are very glad to invite Dr. Thamul Selvi to deliver her talk on empowering innovation through AUA Overseas Study Program.
Okay. Okay. Thank you so much for the kind introduction. And also, I'd like to thank the organizer for the invitation. Today, in the capacity of the past AUA, I'm going to start something that we've been going through in the past 2 to 3 years, which is the pandemic. If you see, the pandemic is really devastating and unprecedented changes happen in the life of everybody, but it's parallelly you can see how the innovation during the crisis was really happening. And this is one of the things that we need to really bear in mind. It does not really reflect the healthcare related issue, but there was more than the healthcare. For example, during this pandemic, we know that in order to address the pandemic or the infectious disease that's going around, there are so many things need to be done. And this is what I would like to really highlight before I go into the AUA program. We know that it was a no time, not in the history that we can really come with a vaccine in a shorter time before, right? So this is something that we know it's like adrenaline in your body that's really rushed you to get something done because you are in a taxing of the time. People are dying. But if you see the vaccine discovery behind it, I can really share one of the very quick information about maybe you don't really see being in the Faculty of Medicine, Dentistry, Pharmacy at the clinical side. What we see is the vaccine and rollout of the vaccine program. I was quite fortunate to be at the Ministry of Health during the pandemic. It was a very hectic time, but it was really something that you're able to see. It's not the vaccine alone. How are you going to roll out this program? You need the logistic, which is a non-science things comes into the play. That's really indicating if you have an issue, the challenge need to be driven for the solutions with a multi or transdiscipline way. And it's also you talk about pandemic, COVID-19 is actually a primary pandemic, but you also have a parallel pandemic happening. What is that? The mental well-being. People are affected, people are actually stay at home, they couldn't really cope up with the stress they go through day to day because everything around them change, economy change, social behavior change, and also this is really impact long-term rather than a short-term pandemic timing. This is where that people slowly adapt to the new norm, which is virtual learning. I'm just giving an example of how that we really moved on into the virtual learning and health become digitalized. that was not really a primary way we run the healthcare before, but the digitalization comes in very handy and was accelerated thanks to the pandemic. But I know it's also very, very unpleasant experience. But really, when I talk through this, what really enabled us to move forward, pass through this really very, very challenging time is the transdisciplinary effort that comes in a handy, as I mentioned, some of the things we don't see, it's beyond the science, it's beyond the medicine. So today I'm going to really showcase how in your classroom you might not really get this experience, but you can really have the experience through many programs. There's many bodies or organizers who provide that kind of experience, and I know the next speaker going to talk about it. I would like to highlight Asian University Alliance, AUA, as one body that really come together to bring that kind of experience to you, the beyond the classroom experience. So this is established by Tsinghua University in 2016, so just a few years back, but they already sponsor 33 student activities, academic conferences run by the awardees or the recipient of the awards. AUS scholars to date is 148 scholars are there, and is one of the beneficiaries definitely from this program. And we have AUA exchange staff program, about 42 so far done. This is actually the data up to March 2023. So as I mentioned, it's a Asian University Alliance, so 15 members are there. Who are they? Of course, you really notice is one of the members, and we are the only member from Malaysia so far. Chulalongkorn University, the Hong Kong University of Science and Technology, sorry, I can't really read this one, King Saudi University, National University of Singapore, University of Arab Emirates University, Tsinghua University, Seoul National University, Peking University, Nazarbayev University, Universitas Indonesia, and also University of Colombo, Tokyo University, and Yangon University. But if you see, even though the members are scattered all over the Asian countries, but the kind of the experience you really get, not really limited to this university. Most of the activities are also open up to many other universities that participants can really come and join. So today I want to give an overview, what do they offer or what do they really run every year or every other year. The first one I would like to highlight here is the AUA Youth Forum. This is one of really interesting forum. I never participate. I really don't know what exactly they do, but it's a flagship program by AUA Executive. This is by the presidency running, so they actually nominate who's going to run that year without you applying for the awards. And these mostly covering the youth empowerment, promoting cultural and academic exchange among the AUA student, and quite a sponsored a program. The next one is Asia Deep Dive Program. This one very much focusing on the multicultural and the communication, how you really enhance the communication between the students community, and also how you bring in your values into the table. The next one is Overseas Studies Program. So if you see these two, they have a very, very unique or very dedicated focus area. But the Overseas Study Program, they are quite a slightly different. It's more like an intensive short course or short-term course where if you have a particular topic, and these most topic that run by these particular programs are the current global issues. So that's where we actually got awarded for the Overseas Study Program to look into the pandemic, how we actually move on after the pandemic. And I must say, Overseas Study Program also allows students to mobile to the host institutions, and you get to train for 1 or 2 weeks. As what we know, student mobility, they have two main types. One is a short-term, one is a long-term. The long-term is what next speaker going to talk about. A semester, she actually spend in another institution. But this is more rather a short-term, and this is beyond what you learn in the classroom, how you apply your knowledge into the solutions, the challenge-driven solution seeking or the ideations. And last not least, but actually there's more on it, but the last program is also the art and sport. Even those who are active in sports, you are welcome to also participate in this one. Apart from the AUA sponsored program, you have a self-sponsored program. From time to time, the institution will run under the AUA guidance. So today I'm just going to quickly run through the AUA 2022 Overseas Study Program. It was quite intriguing. This ideation came because we already have kind of a discussion between the Faculty of Medicine and Faculty of Engineering to try to come up with a forum to discuss how engineering and many other components that really can enhance the medical or healthcare services. The aim of this particular program was to really implant the seed into the student mind that they are able to bring in their knowledge and try to find the solution. And this is very often, as I've mentioned before, this is more of a transdisciplinary approach whereby there is a problem, then you actually go into solution seeking by looking at the multiple perspective, which is you don't really get it in your day-to-day classroom lectures or tutorials or any other activities that you have. So how we did it, unfortunately, we still need to do it online because we initially wanted to do in person, but because the border was not opening, it's not possible for the participant to travel, so we did online. And there was a 3 main way that we run this program. Of course, we had the technical talk, workshop or boot camp, and a hackathon. Let me go through what we have done for that 5 days program. If you see the day 1 and day 5, these are open to all the students who are actually registered as a participant. So it's really an open platform. They can actually apply and then they register and then they can really come in. The day 2 to 4, this is actually only for those who are registered, selected for the boot camp to do the hackathon pitching or the competition at the end. So the day 1, what we did, so one of the things you really need to do before you try to look for the solution is understand the problem very well. I was quite fortunate, Dr. Kuldeep, who's actually the Pengarah, the director of the Sungai Buloh Hospital, that time is a primary site for the COVID-19 management at the national level, able to come and give a talk, really give an overview of a pandemic throughout the human history, and how that she able to manage the hospital with the number of the cases was ever rising at that point. And of course, we want to really bring in the element student to think from multiple perspective. Prof. Adib was really talking about the role of engineering and technology in combating the global pandemic. So this is how you really bring in the different points and perspective. If I'm a medical person, I might not really have a good idea of engineering, but that's where that I'm getting the perspective from these experts. And followed by really grateful to have Dr. Gate, who's really give the big data. If you remember, COVID Now, the website. So that's where we really analyze all the data in terms of the vaccination, the deaths, to really mitigate or really know how to move forward with the pandemic management. So she was really able to give the big data and the analytic to really address the pandemic at that point. So that was really a technical prompt to really prep the students at that point. Followed by, I love this forum because we invited expert from medicine, Prof. Adiba, the previous dean of Faculty of Medicine, and Prof. Ng from Biomedical Imaging, Faculty of Medicine as well, and Prof. Raja Rasya from Asia Europe Institute. He's an economist and really brings all the different perspectives. So from medicine, from education, from economy, from society, how that we're going to move on once the pandemic is subsiding, or how we really going to have the life after that. So the next day onwards, this is a closed section to the participant whereby they started to have all the different experts and the kind of the skill you needed for you to prepare for the hackathon or pitching. Mr. Morelli is quite a good friend of mine, is a very successful technopreneur. Is also, came in to give how to really create the ideation, how to embark on the ideation for the solution driven. He's not a non-science person, but he's one of the fantastic person to talk to if you want to pitch your idea. And we also have Mr. Koi and Mr. Wong, who are the 2 excellent mentors. They are actually the former winner of the Asia Hackathon competition. So we thought nobody else can be better than them to really mentor these students. So at this point, we had 6 teams to really come up with their solutions pertaining to the pandemic. And followed by day 3, we also bring in different experts who actually can give us a perspective in terms of Prof. Victor from our own faculty, give the interdisciplinary actions for the safer work environment, and this goes beyond the education as well. And Dr. Sayuti is also talking about the manufacturing aspects. Is non-medicine, but it's also involved in how you move forward with the global pandemic. And last but not least, on the day 3, we have Mr. Zaki, who also give the mobile app development. If you see how we come with My Sajatra and all those things, is again it's a non-medicine, but it's the essential tools for you to mitigate or pass through or go through the pandemic periods as well. Day 4, Dr. Lim is here. She bringing the different element which is very often underestimated, the art of pitching. We think the presentations, for students, they always have a presentation in the classroom, but presenting your ideations, to outsider is not going to be the same as the classroom. Believe me, I done something for a pitching for 30 minutes, and somebody told me, the VC told me, the venture capitalist told me that that's not the way you go about pitching your idea and the product. Why? Because they are the non-science people. They want to invest in your product, and you have to really know how to pitch it. After the many years, the incidents, I really felt it, students need to be prepared outside the academic world. And this is where that you will really, come in handy to learn all those, the pitching art. Followed by day 5, we were so fortunate to have Prof. Saad, Prof. Adina from our faculty, and also Miss Wong from AUA, who's actually came as a judge, to really judge the 6 teams who put up their idea. I don't want to give too much of the detail because they probably have their idea, they want to move on, to protect it. So just to really give an idea, that some of the works or some of the 5 days or the 4 days working as a team throughout this boot camp and also the workshop, also with the technical talks in the forum, they come up with many different versions, but I can see majority of them come up with the digital or more apps to facilitate people who actually want to come back to the normal life, right? So it was quite valuable because the judges also gave lots of comments on their innovations, on their ideation, how to improve further. And for your information, the way we team them up, they are all from the different universities, different countries. So in this way that you also make friends during your preparation for the pitching. So, and that's hand by the award ceremony. Of course, we select the most top 3 teams and awarded. But if you see that the feedback they give after this particular boot camp, they actually started to see the things which is they thought is not really something that needed for them or relevant for them. It's really beyond what you learn in your course content. So as I mentioned, so the experience definitely beyond the classroom, and take opportunity to learn or to really embark or you participate on those programs which really bring out, you never know how you're going to actually bring yourself into a table where none of them are medicine, maybe they bring the different element, how you're going to come together and bring the ideation to the next level. It's very interesting, can be challenging at the beginning, but towards the end, I do find they gel very well. Last but not least, I would like to thank my team, not everyone here, because it's the last day, but really this program not possible without AUA supports and the grant they provided, University Malaya supports, Deputy Vice Chancellor Academic Office, International Relation Office, because from the beginning they really help us, from the proposal writing up to the last closing of this particular program. Of course, the Faculty of Medicine and Engineering, who's actually provide all the support, and I would like to thank my former team of International Office. And to all the speaker, panelists, mentor, trainers, judges, they are amazing. They really know their subjects matter, and they know how to really gear up the thinking in the student. And most importantly, the participant will really make it, despite it's online, but they make it happen in a very exciting way. I'm giving they have a website, so if you really want to get to know more, but otherwise you might ask how do I know when is the next program coming for me to embark and what kind of a program? You also will receive email in list by the International Relation Office, and nowadays I think they're still in charge for the AUA programs. For those who are actually this is an undergraduate program. AUA also provide scholar supports for the postgraduate, also the academic staff, non-academic staff. So do utilize those opportunity and learn and communicate and networking with the people from different institution and university. With that, I would like to thank for the time. Happy to take any questions you have later during the forum.
Thank you very much, Doctor. Right, so our last speaker for the first session would be Ms. Ilya Maisara binti Tariq, who is recent biomedical science graduate from Faculty of Medicine, University of Malaya. Last year, Ms. Ilya embarked on a transformative journey through a mobility program at Shinzo University, Japan. With a global perspective, today she stands before you, eager to unravel the boundless possibilities and cultural richness discovered along the way. So we kindly invite Ms. Ilya to present a talk titled Everything You Need to Know About Exchange Programs.
Thank you so much for the introduction. Hello and good morning, everyone. My name is Ilya Maisara, and I just finished my final year as a biomedical student from this faculty, and I was a past participant of UM's long-term exchange program to Japan. So today I will be talking about maybe not everything, but some of the things I think you need to know before you join an exchange program. But this sharing session is mainly focused on students who want to go to exchange programs, so maybe you could share some of this information to the students who will be guiding. Okay, so my main motivation of going to an exchange program is because I really wanted to learn a foreign language. So I chose a country that does not speak English, but it depends on you. But other reasons why people might want to go to an exchange program is for personal growth, especially for a very shy and introverted person like me. It helped me become more confident and also more independent. And aside from that, for a really honest reason is that I actually really wanted to take a break from my course here in UM. So I decided to take a gap year, which was actually a very great decision because I came back more refreshed and excited to come back here and learn and also finish my final year here. So actually, the most challenging part of joining an exchange program is actually choosing the university that you want to go, because this can actually affect your whole entire experience during the exchange program, especially if it's a long-term program. So some factors you might have to consider when choosing a university is the country you want to go and visit, and also the course and classes you want to learn, and most importantly, the course. So the university that I chose is Shinshu University, which is located in the Japan's countryside, which means that the living cost is quite low, which is also the main reason why I chose this university, and also because they offer intensive Japanese classes. So some of the challenges that I faced when preparing to go to this exchange program is because I had no seniors to refer to, especially in my faculty and department. So that made things very hard because I didn't know where to go and what to do. So one thing you can do is visit UM's Global Enrichment and Mobility, or GEMS division website, where they have some where past participants can share their experience in their university and also country. So you can look at that to help you decide on which country or university you want to go to. Or you can just go directly to GEM's office in KPS to ask the officers whether they have the contacts for past participants. So you can just email them or WhatsApp them your questions directly. So The thing that I worried about the most before going to the exchange program is actually the high cost of exchange program, because I can't afford to go to an exchange program by myself. So what you can do is do ample research on scholarships. You can do this by visiting GEM's office or website, or just go to the host university and see if they offer any scholarships, or simply Google. And you can also, one thing that really helped me is going on Reddit to see if people had already asked questions that I have. So the scholarship that I received was the JASO scholarship from the Japan Student Services Organization, which gave me around 80,000 Japanese yen per month. So what I did was find a university with an estimated monthly living expenses much lower than the scholarship given. So at Shinshu University, they offer intensive Japanese classes according to your Japanese level, whether it is complete beginner or you are an advanced learner. So that was also one of the reasons why I chose Shinshu University, because I didn't really want to take any classes in English. So if you are an advanced learner, they also offer major subjects where you can learn with Japanese students, which are basically just regular classes. So the good thing about Shinshu University is that they assign a Japanese tutor for you to help you settle down and also become your language buddy throughout your university. So that is my tutor, Hanoi, who is still in Shinshu University in her third year. So here are some tips if you want to make the most out of your program. So one advice I got from supervisors and also past participants is try not to stay in a Malaysian bubble, because this is what tends to happen whenever you go outside of the country, especially in a country that does not really speak English or your mother tongue. So fortunately and also unfortunately for me, there was absolutely no Malaysian exchange students in my university, so I had to get out of my comfort zone, which was very hard but also very rewarding. I pulled through it. So that was me during a club activity with the international and Japanese students during the Hanami or Sakura viewing. The great thing about having international friendships and relations is that aside from learning the differences and similarities between countries and cultures, whenever you go to other countries, when you visit your friends' countries, you always have a place to stay with and also friends to visit. And you can also do the same thing whenever they come to Malaysia. So another thing that I do with my friends is that we always exchange postcards. So it's a very nice souvenir to get from their home country. So this is kind of opposite to what I just said just now. Although you should not just stay in Malaysian bubble, it is still very important to have a support system that you can rely on, because being very far away from home, you will feel very homesick. You will miss your family, you miss your friends, you miss the food and the language that you speak. So it is very nice to have familiar faces. So I went there during Hari Raya, but I didn't really have any Malay Muslim friends that I can celebrate Hari Raya with. So a friend from a neighboring university, from Yamanashi University, invited me to join them in their Hari Raya celebration. So I met a lot of new people there, new friends there. And with those friends, I also went traveling a lot, and also we climbed Mount Fuji. And also finally, please don't spend all your time in your room studying or just watching Netflix. Although studying is still important, but for a normal long-term exchange program, it really isn't that hard to pass your classes. So yeah, please don't do that. So I was very fortunate enough to get the scholarship, and it was enough for me to travel a lot with my friends and also alone. And I also had the chance to go to a lot of places and eat a lot of nice Japanese food. So as I just finished my final year in biomedical science, and it has been around a year since I just got back from Japan. I am ready to get back out there. So I applied to some other programs. I was rejected by some and also accepted by some. So here are some other programs that I was accepted to, which is the Huayu Enrichment Scholarship by the Ministry of Education, ROC Taiwan, which is a scholarship where they allow you to study Mandarin in a language school in Taiwan for 3 months to 1 year. and also the Max postgraduate scholarship by the Japanese government. So if you have any questions regarding any of the scholarships and the Justice Scholarship just now, you can always ask me later. And also very good timing because today GEM, DGM is also doing a mobility outbound clinic which is online in like half an hour. So you can go to your Siswa mail for the link, or you can just scan the QR code to save the link for the meeting later. So that's all from me. Thank you.
Thank you very much, Ms. Ilya. We thank all our speakers for their great effort presenting their talk on this mobility program of FOM. We now would like to invite all our 3 speakers onto the stage for a panel discussion, along with Dr. Jasmine, the mobility coordinator of FOM, to moderate the panel discussion.
Good morning, everyone. So with the interest of time, I would like to open the floor for questions. Do we have any questions from the floor? If not, I will begin with my first. So my first question is actually for Ilya. So I know that you take gap year adventures, right, in Japan. So I was thinking, like, how is actually your decision-making process when you decide to embark on this journey? Because we know that you have to take like a 6 months break from your studies, right? So are you worried about it? Thinking process like? Thank you.
Hello. I was actually very worried about it because for a biomedical science student, and I really wanted to go to Japan. So, but I can't really take biomedical science classes in Japan because they hold the classes in Japanese. So I had to take a 1-year gap year. So that means that I have to graduate a lot later than my batchmates. So I was really worried about that because I would be really lonely during my final year. But I decided that it's a one-in-a-lifetime opportunity, so it's worth it to just graduate just 1 year later. And although, honestly, it was lonely, but I don't think I regret missing out. I mean, not missing out, but just, you know, not graduating at the same time with my friends. But yeah, I think it also depends on what your goals in life are. Mine is not graduating early, so yeah.
Right. So what would be your...
What Ilya said earlier, I can really see your concern there, but also like at the same time, I see maybe the kind of the support system available at the Faculty of Medicine, also at the university, apart from GEM, it might not be like everybody aware. Those who are with the institution and the country that we already have an MOU that comes with the. All right. So we have a database. We used to have it in our website under the International Office, Faculty of Medicine. But because the website changed the format, now we do not have that posted. But we have a database where we have our MOU, MOA, what kind of a collaboration. Is there any student been there before? It could be postgraduate, undergraduate. I often, as a former head of international office, receive kind of the personal request, say, hey, Selvi, I'm sending my student, meaning from an international institution, they're sending to Faculty of Medicine. They say, could you really help them familiarize? That gives you the comfort, though you do not know the institution before. And sometimes it helps you to prepare much earlier. I mean, this is you done the program, but this is for those who actually want to go in the future, get to know what kind of a collaboration the institution to institution we have, tap on it, because they really give you more helpful, including they tell you where to stay, the kind of maybe tutor that they can assign. This is available to all the student, and you just need to know whether we do have a MOU, MOA, or any kind of agreement. And this might not be captured by GEM all the time, but International Office of the Faculty as well as the do have that.
All right, thanks very much for the input. So my second questions will be for Prof. Tengku. So I think these are questions that everybody is interested. Like for we are so concerned about the KPI, right? So how is our performance thus far in achieving the KPI mobility for the Faculty of Medicine? What are the most frequently asked questions that you encounter and the challenges?
Okay, I think for okay, I may have to check with you. Is it 150 for?
Yeah, 150 for inbound, 50 for outbound. Yeah.
Yeah, I think we've nailed it. For this year, and of course with every subsequent year they will stretch within an acceptable, hopefully acceptable percentage. But things has been good, and I think what helped a lot was because there were multiple factors, but we had the ASEAN Medical Dean Summit just in July, isn't it? Yeah. Well, in July, it was just over 2.5 days. But the nice thing is it's not only the deans coming here, but they brought over their delegate of students, and with this and the experiences that the students had was they came here for the academics, but just like with Ilya's experiences, is you want a holistic experience over there. So you want to experience the culture. And so it was a 2.5 day, but it was very, very packed. It was organized tightly down to the last, to the minute. But the students had presentations and forum discussions, poster presentations, and they were addressing current issues in education, in medical education, and the outcome of that was a lot of new proposals to present to all the deans on the way forward, and on top of that. There was also a cultural exchange show where every all the delegates from certain countries will perform, and they did not have time to prepare, but they made the best of the very little time they had, and it was a lot of intermixing, and new friendships were created, networking, and for our students, I have to be. It's not only we can view it in terms of KPI, but what those students gain and our students gain, because our students were organized, and I have to take my hat off that the academics did not do much. We were overseeing them, but they very tightly organized everything, and they had like a pre-meeting with the students before on Google Meet or Zoom, and to the point where they even shared pictures of KLIA. We shall meet here, and they even took where maybe KFC or somewhere, they down to that detail. So everything went smooth the whole day, and they were taking care of the food and accommodation of the students, and new friendship. So basically, even for our students, it was a great experience. And I mean, there was like a nurturing of many things, teamwork, leadership, and so it was great. So great. The KPI was helped a lot by that. But if we view it in terms of just KPI, but what was gained cannot be measured by just a KPI alone. And then the experiences, the new friendships, that you had, and networking, and I have to say that as an academician, by watching the students, I learned a few new things from them as well. So it's a very, very meaningful thing. But yeah, answering your question, yeah, I think we were doing well in terms of the KPI, and outbound is 80, right?
Outbound is 50.
50, yeah. I think
I think we definitely achieved that. With
yeah,
the
we already
medics.
achieved that, and expectedly it'll be stretched, and but hopefully, hopefully there'll be more awareness, and we shall meet these targets. But as I said, it's the desirable experiences which are the prime importance here.
Yeah, definitely. Our students are fantastic, aren't they? So with the interest of time, I would like to extend my last questions to Dr. Selvi. So I'm interested in that because I want to know what is the cash values of the AUA grant that you received back in 2022? I believe they are quite generous because I myself is an AUA scholar. I went to University of Tokyo under the programs. They give us about like $1,000 to $2,000 for a 10 days program only. Yeah.
I think the value for the AUA scholar has been increased, if I remember right, for the past year. But probably one can check. But for the AU program, we got $5,000, and we have. It's not a big amount, but it's reasonable amount because we were able to, because it's online, so we were able to cover most of the kind of expenditure, basically payment to the speakers and judges, and so. Pretty much we spent the 5,000 mostly on that because there was not much other expenses incur. I say so $5,000, yes. But it was really a very supportive beyond the cash value. I think the support they give from the committee was really excellent, and I think we really felt we were guided throughout the program because they kind of gives you how to enrich your programs, how to streamlines your program in a running. Jess, you don't mind I just want to add on one more thing. So you talk about KPI just now to the faculty for outbound inbound. I do know that Fulbright offer the undergraduates mobility program whereby they can spend one semester or summer program, which I know one of the applications, because I'm a Fulbright scholar previously, and also know there's many categories, but do take advantage of the undergraduate program both way, outbound, inbound, because there was one of the application I really evaluated recently was to inbound. The student from US coming here to learn some of the clinical works, and one of the unique things the candidate write is because Malaysia's genetic pool are very, very diverse and very interesting. You don't get it in many other countries. So they say how that institutions that the boy come from and also can really collaborate in the future. This is all brings you a more opportunity in the future. So do take notes of the other opportunity like a Fulbright, and there is a alliance for AU4, I think if I remember right. They also provide mobility. So basically that's is selected European, Russia, the few countries. It's also quite a good one, but this is for academic stuff. So quite a number of ways and maybe my suggestion, nice to have a dedicated website under our FOM to really say what are the frequently advertised mobility programs that people can take advantage of or people can really embark on. Yeah. Thank you.
All right, thanks very much for the great input. If we have no questions from the floor, I would like to close the sessions today. Thanks very much for the great discussions from all our three panelists, and have a great day. Thank you.
Thank you so much. May I request all the speakers and Dr. Jasmine for a group photo? Thank you so much, Dr. Ahmad. Thank you so much, Dr. Tamal. Thank you, Ms. Ilya. Thank you, Dr. Jasmine. Right, so I shall pass over to Dr. Lee for the next session of the day.
Good morning, everyone. This session is about interdisciplinary biomedical research. I'm Wen Chao Lee from the Department of Parasitology, the MC of this session. We will begin this session with 2 talks by our invited speakers, followed by a forum facilitated by a moderator, and finally the Q&A session open to the floor. So today we are delighted to have 3 incredible scientific leaders as our guest speakers and moderator for the topic. The first speaker is Dr. Sharada Subramaniam. Dr. Sharada obtained her degree in biomedical science from the University of Manchester and earned her PhD degree in immunology from Nanyang Technological University, Singapore. Currently, she is the Deputy Director of the Institute of Molecular and Cell Biology under the Agency for Science, Technology and Research, A*STAR, Singapore. She's leading the strategic partnership and innovation initiatives of her institutes with the biomedical and pharmaceutical industries in Singapore. Dr. Sharada will talk about navigating public-private partnerships in the biomedical research ecosystem. Dr. Sharada, the floor is yours.
Good morning, ladies and gentlemen, and thank you very much to the University of Malaya and Dr. Lee Wen Chao for the kind invitation to speak today. It's a great pleasure to be here, and today I'll be sharing a little bit about working with industry and navigating public-private partnerships in the biomedical ecosystem. So what exactly are public-private partnerships? These are collaborative arrangements between a public sector entity, say a university, hospital, or research institute, together with a private company, such as biotech company, pharmaceutical, or startup company. These usually take the form of a co-development project, joint venture, co-funding where both parties sponsor, as well as sponsorship potentially from one of the parties only. Especially in the biomedical sciences field, such public-private partnerships are very important to accelerate R&D and to improve and quicken discovery of therapeutics. It also helps achieve a common goal, which will be difficult for each of the independent partners to achieve independently. As such, it drives innovation, advances research to develop healthcare solutions, addressing complex global healthcare challenges. Some examples of public-private partnerships include initiatives by the US government, Operation Warp Speed at the start of the COVID-19 pandemic, to accelerate the development, manufacturing, and distribution of COVID-19 vaccines. Some of the company partners involved in this initiative include Pfizer and Moderna. Closer to home, we have the Novartis Institute of Tropical Diseases, which is a collaboration between Novartis and Singapore's Economic Development Board, aimed at developing small molecule therapeutics for infectious diseases endemic to the developing world, such as dengue, malaria, and tuberculosis. Public-private partnerships can be really beneficial if we harness the benefits appropriately. Among the benefits include making meaningful scientific and clinical progress in challenging areas. This is possible through the combination of diverse and complementary capabilities which bring together and push forward these avenues. Additionally, it can also foster innovation, as very often these public-private partnerships are multidisciplinary in nature and requires the combination of expertise such as in biology, bioinformatics, medicine, and engineering. Indirectly, this also leads to translation and commercialization of research, whereby there's a clear industry partner or solves an industry-relevant problem statement, and both the public and private entities benefit out of this. This partnership also saves time and costs, as instead of becoming competitors, the public and private entity are now collaborators. They also work together to reduce risks, as any risks are jointly shared and mitigated. While there are many benefits to public-private partnerships, there are also numerous challenges which need to be navigated appropriately. Among these include differing interests and objectives. The public entity's main goal would be to advance R&D and to improve public health. However, the private entity may be largely profit-driven and not so interested in projects without a sufficiently addressable market size or in a space which is too crowded. Additionally, there could be funding challenges. The public entity may have funding limitations compared to the private entity, and as such, find itself in a less of a decision-making position given the less financial contribution that it is providing. This can lead to imbalances in the partnership and affect the progress of the partnership. Navigating challenges in intellectual property and data sharing is another aspect that needs to be considered sufficiently. This is often one of the most important aspects of a collaboration. This includes aspects such as ownership of intellectual property, as well as data, and how it can be used, exploited, and commercialized subsequently. There are also challenges working with startups, especially when the public sector entity may end up being the dominant partner. The startup may be relying on the public sector entity for all kinds of support, including infrastructure support, expertise, and including funding. And the risk is increased, especially in situations where the startup does not end up being successful. In order to forge successful partnerships with industry, we should bear in mind a couple of success factors. This includes having clear goals and alignment in objectives. For example, the private entity may be looking for a quick project whereby they can quickly make a profit out of it. However, as we know, biomedical projects take time, often months, if not years or longer. Therefore, the public and private entity needs to be aligned in terms of the goals, objectives, as well as timeline. They should also be able to identify potential challenges early and have a mitigation plan. Technical and other challenges should be foreseen at the start of the project and a backup plan derived such that when such challenges are met, the problems can be easily solved and not affect the progress of the project. Additionally, commercial aspects should also be agreed on at the start of the project. These include aspects such as intellectual property ownership. For example, it could be agreed that all intellectual property arising from the collaboration will be jointly owned. However, the company would then commercialize such intellectual property, and the revenue or proceeds will then be shared between the public and private sector entity. Performance of ethical research is equally important, especially those involving the use of animals or those involving the use of human patient data and samples. This is especially important when seeking regulatory approval. One should also have clearly defined deliverables and define project financing. It should be made clear if there are any joint deliverables so that each party knows exactly what they are supposed to contribute, as well as sole deliverables for the public and private entity. In terms of project financing, it is also important to ensure that funds are secured and ring-fenced before the start of the project, to avoid a situation that a project has to come to a halt due to lack of funds. Understandably, biomedical research is an expensive endeavor. As such, it is important to look into funding models before we start. Among the funding models include research funding sponsored by the private entity. This is usually common when the company has a very clear vision on what they want to achieve through this partnership. They find that working with a partner saves time and costs. As such, they are often willing to partially sponsor or even fully sponsor such research projects. Another model is a co-funding model, whereby both the public and private entity have interest in this project, however, may not have the resources to work on it independently. As such, they come together, whereby each party provides their own funding sources, such as they fund their own manpower, consumables, and equipment, and there's no transfer of cash between the parties. In circumstances like this, the public sector entity may be able to obtain funding, for example, through government grants. There's also the revenue sharing model. This is more applicable in service type projects, whereby the parties come together to achieve a joint goal. For example, one party may have the technology and infrastructure, but not the customer base, and the other party may have the customer base and the manpower or consumables, but not have the technology. As such, coming together can help to achieve a win-win situation. Similarly, this can also apply for R&D type projects with licensing or revenue sharing outcomes at the end. Innovation is an important driving force behind public-private partnerships towards improving healthcare outcomes and public health. It is important to accelerate R&D, quickening the process of discovery and development of new drugs and therapies through the combination of the synergistic and complementary expertise these teams bring together. Additionally, it can help address unmet medical needs. For example, how the public and private sectors came together at the start of the COVID-19 pandemic to mitigate the problem. Additionally, it can lead to effective and targeted healthcare solutions guided both by the private and public entity. For example, the private entity can guide decisions related to market size or competition, whereas the public entity can guide decisions related to addressing global healthcare challenges. This is also important in terms of contributions to the economy, be it in the development of new technologies, value capture, creation, as well as creation of new jobs. As I mentioned earlier, challenges surrounding intellectual property and patient data need to be addressed sufficiently. It is important to define early how resulting intellectual property will be owned. Some common ownership models include ownership by inventorship. This would mean that whichever party develops the intellectual property will own it. Joint ownership, which means that all the intellectual property will be jointly owned by the parties, as well as ownership by technical area. It is also important to balance the requirements of the private and public sector partners, for example, in the use of patient data and samples. The value for the company may be to be able to commercialize the patient data. However, this may be a concern for the hospital providing such patient data, as they want to retain control over the use of such data. As such, the company and the hospital may decide to come together and agree on an arrangement whereby the company is able to commercialize the data within certain boundaries. However, the hospital also needs to have a copy of such data and be able to use it for their internal R&D purposes, such that the commercialization plan is clear and we don't run into a situation whereby intellectual property encumbrances affect commercialization subsequently. Now, let me share with you a couple of public-private partnerships that we have put together at the Institute of Molecular and Cell Biology in A*STAR in Singapore. The first is a collaboration with a German biobanking company to set up a multi-omics cancer database of Asian patient data. This was to complement what the company already had for Caucasian patient data, and it involved integrating multi-omic data such as genomic, transcriptomic, proteomic, histopathology data with clinical information. Given that IMCB is a research institution, we were not able to enter into this endeavor by ourselves, and we had to engage hospitals and clinical partners to come along with us in this project. This is an example of a multidisciplinary project that leveraged on IMCB's R&D capabilities, the company's data analytics and sample collection SOPs, as well as the know-how in clinical data and samples contributed by the hospitals. Another example is a joint service platform with a startup company to run experiments and perform drug testing. In this case, this was leveraging on IMCB's capabilities in humanized mouse models for drug testing. The startup company in this case was one which was already in the space of in vitro and in vivo drug testing. However, they did not have the technology or the infrastructure to run such service. Meanwhile, we had the capabilities and the infrastructure. However, we did not have access to the customers. As such, by pulling together our resources and coming together, we were able to come up with a win-win situation and provide such services to customers, whereby the revenue was eventually shared according to a pre-agreed ratio. This ended up being a good arrangement for IMCB as well, as the startup company grew more and more interested in the relevant technologies which IMCB was developing, and eventually licensed some of these technologies. Now that I've shared a little bit about the benefits, challenges, as well as success factors in navigating public-private partnerships, let's see how we can enhance the industry relevance of biomedical research. One of the ways is in understanding industry problem statements and industry trends, and aligning research goals with what will be useful for industry. This involves understanding the market trends, understanding opportunities, challenges, and taking advantage of opportunities coming along our way. It is also important to focus on applied research, which will have a translatable or commercializable outcome. Generally, this refers to research with higher technology readiness levels compared to blue sky research or basic research, which may be more difficult to commercialize. Being collaborative, innovative, and adaptable will increase our attractiveness to collaborate with industry, as industry partners would be very happy and with open communication, as well as adaptive and innovative partners who can pivot or change their research direction. Best-in-class capabilities could be in the form of a technology platform that can serve as a plug-and-play solution to address the industry's problem statements. And having had worked with other industry partners will also increase our reputation to be a reputable partner and therefore attract more collaborations in the future. In conclusion, there are many benefits of public-private partnerships, including driving innovation, improving healthcare, and addressing global healthcare challenges, as well as encouraging commercialization, translation, and saving time and costs. To ensure that these partnerships and some ways include identifying each party's roles and responsibilities early, ensuring the project is sufficiently funded, having commercial positions agreed upon early, having project management to ensure that the projects run within the stipulated schedule, within stipulated time, and within the stipulated budget, and communication is always key to ensure that all these partnerships are smooth. With this, I hope I've been able to share some perspectives on navigating public-private partnerships in the biomedical ecosystem, and I thank you for your attention. Thank you.
Thank you, Dr. Sharada, for the inspiring presentation. The next speaker for the session needs no introduction here. Professor Dr. Umarani Kupusamy received her degree in biochemistry from University Malaya, followed by a PhD degree in antioxidants and free radicals from National University of Singapore. Professor Uma works as an educator for many years in the Department of Biomedical Science, Faculty of Medicine, University Malaya. She's also the chair of the Health and Wellbeing Research Cluster of University Malaya. Prof. Uma will present to us Health and Wellbeing Research Cluster and Interdisciplinary Biomedical Research in University Malaya. Prof, the floor is yours.
Thank you for the kind introduction, and very good morning, everyone. And I would like to, first of all, congratulate the organizing committee for the successful, the carnival that you have organized, and also thank you for inviting me to give this or share some knowledge on our cluster. And so what I'm going to talk about is basically not give you a lecture, but just share with you all what goes on at the management level, okay, as far as the research cluster and also the interdisciplinary research is concerned at University Malaya. So, okay, now what's a research cluster? Well, it is basically a versatile and adaptable mechanism or platform for facilitating research across internal external institutional boundaries. In other words, we don't want discipline-based research. So what you mean by interdisciplinary research is there's an amalgamation of the different disciplines in order to solve a common goal or solve a common problem. Okay, so basically a research cluster is supposed to create opportunities for people to meet, encourage people to step outside of their comfort zone. Usually we are comfortable working in our own disciplines, majority of us, all right? So this research cluster facilitates or helps people to think out of the box and step outside of their comfort zone, and also eliminate structural barriers to collaboration, and also increase the visibility and also the impact of research. Excuse me, impact of research. So you all very well know that breakthroughs in biomedical sciences is a driving force in when it comes to advances in healthcare, and more you can see that it is essential to incorporate other disciplines to create an effective translation of research towards a healthy individual and society. So in other words, it's the holistic approach to solving problems, all right? And you very well know that the benefits of team-based, collaborative, and interdisciplinary research, okay, it can lead to development of solutions to grand challenges, can increase multi-sector engagement. You may have a better chance of obtaining research funding, and also can lead to higher researcher productivity in terms of publications, patents, commercializations, and so on, and increase citation impact. So in other words, in the context of especially, you may find that it'll be possible for you to achieve your KPI without any effort, all right? And of course, ultimately, it lead to greater positive impact to society and humanity. All right, so having given that very brief introduction, let me get back to the sharing session in terms of the research at UHAM. So this is a very busy slide, but this is the overall structure. Okay, maybe if you have taken the trouble to look at the website, you would have come across this, but I know most people don't actually look at the UHAM website. So I'll just take you through briefly. So you have the Institute of Research Management and Services. Okay, you have an executive director here. And under this, you have the IPPP main office. Of course, the acronym is in Malay. This is for Institute Penyelidikan. Okay, and Research Grant Management Division, and also the Research Service Division. All right, so under this, you have the High Performance Computer section as well as the Publication Enhancement section. And then you have the Higher Institution Center of Excellence. This is, actually we have 4 of them, so as listed here. And what's different from the Center of Excellence that you must have heard quite frequently lately is that for these Higher Institution Center of Excellence, there's some funding that comes from the ministry. All right, and then you have the University Malaya Center of Excellence, which is the top-down centers by the university. And so there are 2 of them, as stated here. And then you have the University Malaya Community Engagement Center and University Malaya Sustainability and Development Center. All right, under this, you have the Rimba Ilmu, Makerspace, and also the Eco Campus. And of course, now we come to the research clusters. There are 4 research clusters, and I'm the chair of the Health and Wellbeing Research Cluster. Now, what does the research cluster do? I will elaborate in a short while, but basically it crosses horizontally across all these. All right, the roles may involve taking care of some of the activities that seem to be involving especially the IPPP. All right, so I shall highlight some of the specific roles of research clusters later on. Now, apart from that, you have top-down research centers. There are 50 of them, and more recently, there were 2 that have applied to form, 2 faculties have applied to form research centers. So, I wouldn't say all of them are under the research cluster's purview. Some are under the respective faculties' purview, and we manage, especially if the members are from different faculties, then the research cluster sort of takes care of these research centers. And of course, as I mentioned earlier, more recently there has been 18 COAs formed, all right, and we have already obtained the Senate approval. And most of the COAs have already started applying for grants and so on. Okay, now this is the structure for the research cluster. So we have the Vice Chancellor, followed by our Deputy Vice Chancellor for Research and Innovation. And under this, we have the 4 research clusters chairs, okay, where I'm the chair for the health and well-being. And we have 3 pillars in terms of our major roles. So we have the research funding, training and empowerment, and also the networking and engagement. So we have 3 capable assistant registrars who are in charge of these 3 pillars under our purview, because we have 3 of them taking care of all the 4 research clusters. So in other words, whatever activity carried out pertaining to these 3 pillars under the different research clusters, they will be there to assist. So we don't have like a specific assistant registrar for each of the research cluster. So this is the overview. And of course, we have other support staff to help the assistant registrars. Okay, so that's enough with the management. And then now, in terms of our vision, is to be a platform for researchers in achieving research excellence for the betterment of the society. And our mission is to foster impactful interdisciplinary research in niche and thrust areas. All right, like you have heard what Dr. Sharada mentioned just now. Of course, in Singapore, or rather in NUS, it's like they have really advanced, and we are learning. In fact, I have learned a few tips from what she has already discussed earlier. All right, so hopefully we can translate and apply that in our institution. All right, so the aim basically is to empower researchers in achieving research excellence and establish collaborative research, foster impact-oriented interdisciplinary research. And I think one of the major roles played by the cluster is to serve as a think tank for strategizing research direction as well as the policies, and also to strengthen the niche and thrust areas. All right, so several initiatives have already taken place. It's as stated here. So in terms of the grants, and then the strategic partnership, external grants, visibility, research empowerment. I will elaborate this in a short while. Okay, talking about niche areas and thrust areas. Well, you all very well know aspires to be the preferred partner in research and champions interdisciplinary research in alignment with the national research landscape. In fact, these niche areas and thrust areas were brought on based on the 12th Malaysian Plan, okay, RMK 12. All right, so based on that, these are the identified niche areas, and these are the thrust areas. So you can see for the health and well-being, we have the cancer and active aging as the niche areas, and innovative health, mental well-being, and lifestyle diseases being the thrust areas. But trust me, this is not like a sort of a fixed kind of niche and thrust areas. We are actually in the process of revising this and updating. All right, so it's not going to remain as such forever. So we will update according to the change of time and current needs. All right. And of course, everyone has been asking about what is this COE and why you have so many and so on. Well, why we have so many? Well, I can't answer that because apparently it's a bottom-up initiative. The researchers themselves had a workshop, and finally they came up with this. Various groups came up with the ideas. But just to broadly we are assigned the different COEs under the various clusters. So social advancement and happiness. Under this cluster, you have all these various COEs. And under the health and well-being purview, we have the digital transformation of health, innovative medical devices, and also the natural products, biopharmaceuticals, and precision medicine. So if you notice, these first two are based in Faculty of Medicine, whereas majority of the members are from the Faculty of Pharmacy. Okay, however, if you ask me what is the role of the cluster then? So in fact, currently since I'm the chair, so what I have done is to actually facilitate discussions and basically engage these three COEs to actually talk about if they have any common projects, that maybe involves the same target group, or maybe they have a common goal. So they can come up with projects that involve all three. So in other words, I basically encourage them to break down the boundaries, although they may belong to the different COEs, but it is important so that you can actually execute the truly interdisciplinary research. All right? And then you have the frontier of natural world, and you have all these COEs under this, and also the industry, innovation, and sustainability science, and you have all the various COEs. So now, these are some characteristics. I won't bore you with all the details, but there are like 6 different characteristics that has been identified. And one, I would like to draw your attention to this fact that it is highly integrative. It means that it's open to everyone from any faculty, whether and also high COEs or COEs or the Center of Research, to be involved in research projects that lead towards solving national and global issues. So in other words, it's the problem-based solving that we want. All right. So when it comes to research, you identify the problem and how you're going to solve it. So regardless of what discipline you belong to, as long as you're able to solve the problem. Okay, now this would be the main roles of a research cluster. As I mentioned earlier, 3 pillars. One is the training and research empowerment, where it may involve upgrading skills, face-to-face research proposal clinics, proposal enhancement, or research proposal, and impact development workshop, which includes some training sessions on how to pitch. And next, you have the networking and engagement. So here, the collaboration with academic institutes, government agencies, and private industry and local and international. All right. I shall elaborate this in a short while. And also the research grant, we are involved in handling some of the research grants. So basically, our major role is actually developing, one of the roles is actually to develop research grant guidelines and terms of reference, and also managing internal research grants and evaluating external research grants. So when we say evaluating, it doesn't mean that the cluster chairs are the only ones who evaluate, but we play an important role in identifying the panels, all right, making sure we contact the right people to evaluate the right proposals, the appropriate proposals. And then we also play supporting roles in terms of handling or take care of the proposal enhancement unit. If you're all aware of the fact that, I'm sure you're aware of the fact that there has been a new unit formed at the university level. Okay, that is the Proposal Enhancement Unit. And then also the Center of Excellence, as well as, in fact, for the 18 Center of Excellence that I mentioned earlier, we are the temporary, I would say for the time being, we are the caretakers, or rather we oversee the activities and encourage and facilitate various activities, including pitching for grants and so on. Okay, however, things may change in future. All right, and of course, the Center of Research, as I mentioned earlier, there are 50 plus another 2 that I mentioned. So there'll be 52, and not all of them come under the cluster. Some are taken care of by their respective faculties. All right. Okay, now, when it comes to training and empowerment, I've already highlighted proposal clinic. We carry out workshops, all right, including workshops such as the organized events to help researchers improve their skills in research grant application, reporting, and communication skills, especially the pitching. And also, more recently, we have embarked in workshops, in conducting workshops on research, responsible conduct of research. In fact, these are all, I would say, some of the good practices that we already have at the Faculty of Medicine. And we are adapting this, in fact, me being there for the past 2-3 months. So I thought this might be a good idea to implement and, carry it out at the university level so that all faculties benefit as well, because this is bravo to Faculty of Medicine. We have very good practices, I would say. And then, of course, carry out sharing sessions where we provide a platform for the successful recipients of grants to share their success story, experience and journey with the other researchers. And okay, I don't have to repeat this, Proposal Enhancement Unit, which is a new unit. And here what we do, or what we intend to do in full force as soon as possible, is that one of the important things we have to do is identify potential researchers who can serve as committee members to help conduct or execute the activities. And then, of course, encourage unsuccessful applicants to prepare and enhance their research proposal for other grant applications, and also assist or guide research proposal writing based on the requirements of the grant, because very often people are able to write very beautiful research proposal, but it might not fit the requirements of the grant that they are applying for. So this is where the Proposal Enhancement Unit can come into picture and help. Okay, and also review the content of the research proposal application and provide constructive criticism, right? So this is a level before it's actually submitted to the evaluation panel. Okay, so this is like to help you to improve. All right, so these are some of the activities like for training and empowerment. In fact, there's a lot more. So these are just some pictures here. Okay, we have the pictures of the proposal clinic, and also recently we had the training with the Malaysian Industry Government Group for High Technology, the MITE. Okay, this was more of a scenario planning workshop. Okay, we invited all the representatives from the 18 COEs. Okay, and of course, sharing session. One example is the SATRAPS grant. So here, Prof. Noor Saada was the person who actually shared her journey. And then we have the networking and engagement. So it may involve the industry-sponsored projects, connecting or bridging researchers with stakeholders, and also promote R&D alliances with industry and partners. So there are various entities that have actually been engaged for this. Okay, so these are just some pictures to share with you. Even Malaysian Rail Development Corporation, but of course this is not directly linked to the health and well-being or biomedical research. So, but we have others. Sometimes it's surprising. It may be like Sime Darby Property, all right? The company that was willing to give research grants. But we would think that this is more for engineering or built environment. But they said that they would also welcome research proposal applications for research grants pertaining to maybe the mental health and so on. Okay, in how innovatively you can come up with the ideas. So they were willing to consider, giving grants for this kind of projects. So to just share with you some of the networking and engagement activities specific to health and well-being research cluster. So I've listed here. So we have engaged Ministry of Women, Family and Community Development, Department of Social Welfare. So where we facilitated a discussion with the Petronas on one of the IIRG program. Okay, it involved the enhancing engagement of people living with dementia. Then we have WHO. Discussion on project entitled Psychometric Properties of Instruments for Measuring Elder Abuse, and also the discussions on 5 priorities for the United Nations Decade of Healthy Aging. So in other words, this is mainly to tackle the older people. All right, now also the Social Security Organization, PECESO, and Tetra Pak, and National Anti-Drug Agency and Ministry of Health as well, for the various specific engagements. All right, now as far as the research grants are concerned, the cluster is involved in the grant management, especially for the internal grants. So I've listed some of these internal grants. And so we are involved in the pre-award process, where we also come up with the terms of reference, and also the form itself, like what are the criteria expected and so on. And also the announcement, peer review session, and also pitch your pitch, or rather pitch your project session, and also final announcement of the award. And also the grant evaluation itself, we also are involved in the external grant evaluation. These are just examples of the local, rather national grants, but we also have international grants that from time to time we are actually requested to carry out the evaluation. And also the grant monitoring, so monitor the progress and achievement of projects, ideas for improvement to achieve target. Okay, and also the grant reporting itself. Okay, so we analyze the success rate and so on. All right, so the data is basically done by our cluster. All right, so in terms of the interdisciplinary research, IIRG is one of those which truly practices the interdisciplinary research, where there is crossing the borders and breaking down the boundaries, all right? So you would have experienced those who have successfully obtained the IIRG grants. Okay, and more recently, okay, this is the last, yeah. So we have Translational Research Program 2023. was considered, or rather was named as the lead university for the health sciences. And we came up with the title, overall program title, Improving the Health and Well-being of the Malaysian Population. So in fact, out of 95 applications, only 6 projects were selected. And out of these 6 projects, there were 2 projects, which was actually amalgamation of 2 or 3 different projects which were submitted by other universities. So we brought them together. So as a cluster, what we did was to encourage this interdisciplinary collaboration, and for better impactful project, we actually facilitated the discussion and encouraged especially when they had common goals and common, the target group, okay, for their research. So we facilitated that and successfully managed to encourage them to sort of merge. And in fact, this Monday would be the presentation at Ministry of Education and, Ministry of Higher Education, and hopefully they will all be successful. Okay, now that's all. Thank you.
Thank you, Prof. Uma, for the informative talk. We would like to ask Prof. Uma to take a seat on the stage and invite Dr. Sharada to join her on the stage for the forum. Now, for this segment, we are honored to invite another incredible scientist as our moderator. Associate Professor Dr. Tan Ai Hui is a consultant neurologist at University Malaya with a subspecialty interest in Parkinson's disease and movement disorder. She's a member of the Malaysian Movement Disorder Council and the head of Research Management Unit of the Faculty of Medicine. Associate Prof. Tan, please join us and initiate and moderate the forum. Thank you.
Thank you very much, Dr. Lee Wen Chow, and a very good morning to everyone. I'm sorry to let you know that actually we started this session only at 9:45. We started 15 minutes late. I see Prof. Ng already here. So we'll try to, keep this forum interesting, short and simple with some take-home messages. I think I see a diverse attendees here. We have people from early career researchers to senior researchers. And I think that the topic of the forum today is on interdisciplinary collaboration in biomedical research. I think that in any of our research conventions or conference, we always like to mention this keyword, collaboration, collaboration, and collaboration. I think it's a very nice word to say, but it's sometimes quite difficult to walk the talk. So perhaps in this forum, we should try to learn some practical strategies from Prof. Uma and Dr. Sharada's journey in interdisciplinary collaboration. Now, I think in my experience, even as an early career researcher a few years ago, I always find that taking the first step is the hardest. Starting something is hard. So I think my first question to perhaps Prof. Uma can answer first is, how do we begin? How do we find collaborators? How do we start a collaboration? Would you like to answer this first?
So how do we start? Well, to tell you frankly, when I first started, I was working alone in silo. That was many years ago, about 30 years ago, I would say. So because that's what we knew. So we carried out research based on what we knew. So then later, when the hardship came, in other words, in terms of getting funding and also completing what you actually propose to do. In fact, you know that the problem you want to solve, but you know you don't have the technology or the expertise or even the facilities. So that's when I realized that you have to collaborate. And of course, I was fortunate to have like friends, colleagues who introduced other researchers or even clinicians. Like that's when my clinical collaboration started. In fact, about a year after I started here as a young lecturer, I managed to get clinical collaborators. So my first grant was IRPA, the Intensified Research in Priority Areas. That was an ancient ministry grant. So then it took off. So in terms of like getting other collaborators, I mean, this is like through introduction, but we also like once you start attending conferences, so you can have this nice networking. And also sometimes when you read papers, published papers, so you identify, like, this is interesting, it's like in line with what you have. So you can actually write to those authors and start the conversation, or rather the discussion to have a collaboration. all right? Because then we didn't have all these activities that you have right now, either conducted by the IPPP or the research cluster and so on. Those days, it's like up to you how you do. So, but that's how it started. And I realized that when you're working in silo, it's like publication doesn't, it's very slow. Like maybe 2 years you have one publication, especially if it's a research-based article. But later with the collaboration, you can solve more problem because it's like a cooperative effort. So, and that sort of, I could see the publication increase and the impact also.
Here are a few key strategies. One is introduction by our own peers, maybe seniors and mentors as well. Two is meeting through collaboration, research meetings or conventions. I do find that when it comes to meeting people at research conventions or conferences, probably the smaller meetings are the one where collaboration take place, not those large conferences with thousands of people attending. So nowadays, I tend to sign up for smaller meetings where I can get up close and personal to the people I want to meet. And thirdly, by also picking up, potential collaborators through their work in publications. I think these are very important points to take back. Now then we identify the collaborators you want to collaborate, but the important question will be, how do we know that they are a good match for us? How do we know we're going to be, good friends? Or, so in research, sometimes it's like a marriage. You don't want to marry the wrong person in your collaboration. So Dr. Sharada, do you want to share with us how do we find a good match for our collaboration?
Yeah, so I think one of the ways that we ensure we try to be a good match is we try to be upfront at the start as to what each party is trying to get out of the collaboration. I think it's very important to have the objectives aligned from the start so that we know how, as well as have expectations on whether we're expecting a publication, a technology to be developed, whether it's a short-term project, long-term project, whether there's one party who is the lead or one party who is supporting or both parties are co-leads, so that all these expectations are set up from the front, from the start. It's also very important to have synergistic and complementary capabilities. So these partners should be able to merge their capabilities together so that they can achieve more coming together. And should also have sufficient understanding of the other party's area of work. This will actually help the partners to actually appreciate each other's contributions and meaningfully put together any data. But another suggestion I could add also to see whether these partners can be good matches would be to start off with a small project. Maybe start off with a pilot project or a POC type project to test the relationship, ensure that the goals are aligned, the partners can work together. And once we have this first project successful, then we can come together and apply for larger grants or even industry projects. Thanks.
Thank you very much, Dr. Sharada. And just now I mentioned that taking the first step is difficult, but essentially moving towards the finishing line is even more difficult. So, presumably that we found a good collaborator, which is a right match to us, then how do we then ensure a successful collaborative journey towards the finishing line? Many times we sort of enter the collaboration meeting, we have a very good first meeting, and then nothing happened. So maybe this question I would like to pose to both Prof. Umar and also Dr. Sharada. Can you share with us some tips on how to ensure a good, successful collaboration that goes towards a finishing line? And probably we will end this forum by these tips from both of you.
Okay, for a good collaboration, it's very important. I think to me, I've always made sure that the terms are spelled out. So in other words, who is going to carry out which aspect of the research and who is in charge of that? Means you have your respective expertise, but of course this is a common goal that you want to achieve, right, in terms of carrying out the research. So in that sense, you have to be very clear about who is carrying out which. And so in other words, make sure you don't have any so-called sleeping partners, means people who are there in namesake only and they don't do anything. The project leader or rather the PI should be strong enough to eliminate such collaborators. I know sometimes it's hard, but I think that's important for a good the project to be a success. All right, and of course frequent meetings to ensure the progress is going on. And also you have to make sure you spell out terms in terms of like what's going to happen when it comes to data sharing, data ownership, let's say there's IP issues, anything, you have to spell it out. All right, so in fact, you'll find all these matters discussed quite elaborately in the responsible conduct of research module. All right.
Thank you, Prof. Uma. Dr. Sharada?
Yeah, to add on to what Prof. Uma mentioned about communication, actually, I think that's one of the very crucial factors in ensuring the success of a collaboration. Open communication between the parties, as well as taking the effort to understand what the other party is working on. There could be some barriers in terms of interdisciplinary research, in terms of not having a full understanding or appreciation of the other party's work. So trying to break down these barriers is very important. Project management is also another aspect which I think is crucial. So especially when there may be different work streams running in parallel, and at the end we need to consolidate all these work streams for a meaningful outcome, it is very important to ensure that all projects run according to the proposed schedule, within budget and within the time frame. Additionally, a fair credit system would also help to ensure that all the partners feel happy and rewarded, and they feel that their efforts are justified. So for example, at the start of the project, it may be useful to already determine about the authorship outcomes of the project, and if that technology will be developed, potential inventive contributions, who will be listed as inventors on patents, etc. So that we don't it doesn't lead to a situation at the end whereby parties feel that their contributions were not recognized sufficiently. Yeah, thank you.
Thank you very much, Dr. Sharada. I probably would like to also add on a little bit from my experience, small experience compared to both of you, but I learned that it's very important to set the next meeting. So after the first meeting, it's very important to then set the next meeting date and the key milestone for the next meeting. I think we all work better with like a deadline, a timeline. Like, for example, I myself usually will try to finish the task just before that deadline that was given to me. That's one. And two is, I think it's very important to be able to appreciate people who are in the collaboration team with us, whether they are doing a small effort or a big effort. This ability to recognize the contribution of each team member and appreciate them and celebrate the success together somehow will naturally boost up everybody's spirit, and then we run to the finishing line together. So I think that we have probably run out of time for this forum. I wish we have more time to learn from Prof. Uma and Dr. Sharada, but please join me to give them a round of applause. We are very, very privileged to have the opportunity to learn from them. And I pass back this floor back to you, Dr. Lee Wen Chow. Thank you very much for organizing this session for us, Dr. Lee.
What an interesting exchange of ideas and information. Thank you very much. We learned a lot from the three of you. With this, the session is approaching its end, and I would like to take this opportunity to deliver the tokens of appreciation for our guest speakers and moderator. And I would like to invite Dr. Krishna Murthy Ganasan, the chair of Health Academia Month and Research Carnival, to do this. Let's begin with Dr. Sharada. Wait, hold on. Okay, let's begin with Dr. Sharada Subramaniam. And Professor Dr. Uma Rani Kupusamy. Last but not least, Associate Professor Dr. Tan Ai Hui. Thank you so much, Dr. Krishna, for delivering the tokens of appreciation. And once again, please give a round of applause to our guest speakers and moderator for the interesting exchange of ideas. And a big thank you for everyone for attending this session. Please stay tuned for our next session, which is a talk given by Professor Ng.
A very good morning to ladies and gentlemen. Without further ado, we commence the next session. It is an honor to introduce to you an individual of exceptional distinctions and expertise in the field of medical physics, a true luminary in the domain, Emeritus Professor Dr. Ng Kwan Hung. I guess we don't need an introduction to Prof. Ng, as he is a renowned scholar, but I have to do this for our formalities. With an illustrious academic background, Prof. Ng earned his PhD in medical physics from University Malaya in 1995, preceded by an MSc in medical physics from the University of Aberdeen in 1980s, and a basic science in physics with honors from University of Malaya in 1978. Professor Ng's contributions extend beyond the classroom. He has taken on administrative duties as the head of coordinators of the Department of Biomedical Imaging at the Faculty of Medicine, a role he has held with the distinction since June 1998. Recognized for his remarkable contribution, Prof. Ng has received numerous awards and honors throughout his career. Notably, he was granted the International Union for Physical and Engineering Sciences in Medicine Fellowship in 2020, a testament to his global impact in the field. In 2020, he was also awarded the Merdeka Award, a prestigious national recognition presented by Petronas, ExxonMobil, and Shell, showcasing his profound influence with his home nation, Malaysia. Furthermore, Prof. Ng's dedications to monitoring and fostering the talent is evidenced through the awards received by his students, such as the Best Student Poster Presentation Awards at international conferences. In recognition of his outstanding contributions, Prof. Ng was honored with the Marie Curie Award by the International Organizations for Medical Physics in 2018. Ladies and gentlemen, it is with great administrations that we welcome Emeritus Professor Dr. Ng Kwan Hung, an icon in the realm of medical physics and a true leader in academia. As our distinguished honorary professor at the Department of Biomedical Imaging, Faculty of Medicine, Prof. Ng's contributions continue to shape the future of medical science, and we are privileged to have him among us. Please welcome Emeritus Professor Dr. Ng to deliver your talk. Thank you.
Good morning, selamat pagi. First, I have to thank the organizing committee inviting me to give this, the last talk of this whole week, jam-packed of talks, workshops, and lectures. It's a privilege, and thank you, Dr. Krishnan, for the introduction. It's interesting that to listen to this talk for a broad cross-section of audience, not only early career, but mid-career, lecturers, academics, and for many of you are pretty senior, look at it as an opportunity for you to pause and to realign or re-evaluate what are you doing at the University of Malaya. So I've chosen this topic, learning with purpose, making a difference in the world. earlier Prof. Marani was talking about all these grants. I'm sure sometimes you wake up having nightmare and saying, oh, is my grant successful, or what do I do to improve on it? So perhaps this is our main purpose while we are here. This is appropriate cartoon, my favorite too, from Snoopy. I wonder why I decided to be a dog, and I was fooled by the job description. So I wonder why we want to be academic, or why we want to work at the University of Malaya. Perhaps the job description or whatever perception we have. So with different purpose. Now those people have made a difference in the world. You probably recognize them, right? From Gandhi, Churchill, to the Roman Empire, Emperor Julius Caesar, and to the others like our dear Queen Elizabeth II and Nelson Mandela, and so many of them. So they really have made a difference to different extent. But other people, some are very humble people, like Mother Teresa and Malala, the Nobel Prize winners. They are not scientists, not statesmen, but they have made contribution to the world. And Greta and Steve Jobs and this guy make big name in Malaysia with the opening of the Tesla, the motor electric vehicle. So they too are making some difference in the world in different ways. And there are other people as well. We look at some of these newspaper cutting. Teachers make an impact on the students. There was one big headline. This teacher was helping one of the students to pay for the university entrance fee, and only recontacted the teacher 36 years later. And we also have like example at the university at the A&M in Texas. Make a difference day. Perhaps next year we should do that, Dr. Krishnan. Make a difference day. So what we can do. And many of our students from faculty and elsewhere have contributed a lot during the pandemic with the vaccination centers, doing duties and helping with the registration, talking to the older one, explaining to them. So we have also made a difference. And there are various societies, CSR by UM, you might not know, but there are a lot of them, such as the Left Pearl English Language, encourage the rural area schools to learn English, or Mr. DIY, they contacted industry, the DIY contributed materials, they have innovation in projects, competition. So there are different ways that as students, they too make a difference. And go back to that, it was interesting. There is an exhibition I was there yesterday, IGM, about green technology, about sustainability, and also coincide with the International Science Council. I've been attending yesterday and I'll go there later on. We talk about climate change, about existential threat to humankind. And young Greta really have shown a good example. Been such a young person, have promoting those for her generation and the future generation. And also Malala too, the example about promoting change to the world. So young people too have made a difference. The questions we often will ask ourselves, what matters to us? Why are we here? Why do we hope to achieve in a context in academia, grants and papers, promotion? And where do we want after graduation? To some of you are a student or PhD students. So these are the pertinent questions. So we need words of wisdoms and experiences. What research should I do? What grant should I apply for? Or I want to be inventor, and all these fantastic dreams that we often have. And let's go back to the wisdom. And we are very fortunate to have His Royal Highness, our Chancellor, Sultan Nasrin Shah. If you pay attention to many of his speeches, this is taken recently in February. He talked about advocating the passion for science and humanities. Really, we talk about interdisciplinary, linking the science, humanity. And there he's setting a good example. In one of the speeches, he mentioned about preparing minds of the next generation for the challenges. We must ensure that all students have the opportunity to develop their creativity as well as strong sense of ethics and values. And these are very important, not just doing research, publish paper at the expense of unethical practice and without the values. And he also continues to say that for the pursuit of wisdom in all its form, different aspects of wisdom, not necessarily from research or but simple lay people also have the wisdom, and that we can learn from His Royal Highness. And that's why the UM have this purpose why we are here. Right? We have this fantastic vision, mission, and the core values. Impact, pushing the boundary of knowledge, nurturing aspiring leaders. So the keywords are impact, knowledge, leaders. And to achieve this, we have these core values, the poise. Right? We all know about that. Passion, oneness, integrity, sincerity, empathy. And really it is the sum up, or we may say the epitome of what the UM is around, what we stand for. And while preparing this talk, I have a lot of chance to discuss with our Vice Chancellor on this. It was very supportive of that. And this is taken from, just appeared last week, beginning October, his message for last month. As a Vice Chancellor, I hold a deep conviction that every student should experience a consistent and holistic educational journey at UM. It's about more than just curriculum. It's about shaping the essence of what we envision our UM graduates to embody. Right? So we have this shaping the essence. What is the essence? The main thing, what is a vision? And he went on to say in this way, we are not just crafting graduates, we are shaping global citizens, thinkers, and leaders. Much higher goal. It's essential for all of us to understand and share this vision. Beyond academic knowledge, we are nurturing well-rounded individuals prepared for the challenges of tomorrow. So he's preparing for the future, facing a lot of uncertainties, a lot of for example, the climate change is high on the agenda and various threats that we face. So we are prepared for that. That sets University of Malaya different from the other universities. Right? His fantastic vision of Vice Chancellor. So with this background, let's continue to develop how we can achieve that. And he gave this, one of his favorite, he mentioned, asked me to say this in this talk, complacency is the greatest enemy of success. Complacency. And it is true, having achieved a pretty high score for our ranking, some of us may feel, well, we are there and we can relax a bit, right? But there is a problem. The word complacency from Latin, complacent, is very pleasing, very comfortable. So it's tepid, right? We are happy, comfortable, we don't want to do anymore. And this is exactly what happens, is a cause of failure or downfall. You look at the fall of the Roman Empire, it's a good example, right? Very complacent, they reached, they were powerful, but they fell. And many human disasters too because of complacency. A good example, look at all the flood around in KL or PJ or other states. It could be prevented, right? If we do the job of cleaning the drain, the rubbish, and so on. There's many examples. And even companies, a good example, Yahoo and Nokia, they were great companies, great products, but they were complacent about the success. They didn't work hard, so they saw slowly disappearing. They lost their luster. So we are all complacent in a comfort zone. If we are still stay there, we think that, oh, we are there, we are great, we don't need. And we have fear to go beyond. The fear is very important. We don't want to go beyond this boundary, particularly interdisciplinary research as well. We are fear to go to learn new things, to interact with, let's say, our colleagues from social science, humanity, elsewhere. We just stay put here. But there is need to learn. The theme of the talk is learning with a purpose. Well, we learn, we explore, discover, as His Royal Highness mentioned, discover, develop skills, acquire knowledge and wisdom, very important, much higher order, that the wisdom that we need, of course, solving problems, problems for the society, for the world, and go beyond learning. That will be the purpose, where we have growth with purpose. We need always grow. It's not a natural grow, but we need to have a purpose, where we have values with us, we live with that. We also add values to others, meaning, for example, we mentor others, we inspire others, and this is where we add values to others and finally create impact. That's what vision is, impact the world. Right? So we need to have that purposeful or intentional growth with us. So you can see this logical path where you can have the impact and we can make the difference. The fear is something very important. All of us fear of everything, isn't it? The child fear of, the parents won't give him or her the toy or whatever demand, and even rejection in different parts of life, right? We have this rejection, being refused a proposal, or we fail in a grant application, or many other things as well. Not all rejection is bad. I see this reject shop, we get good stuff there as well. So it's part of journey, particularly academic. We are publishing paper, doing research. Right? A good example here, I was quite early in my career. The JBJ is one of the very prestigious journals in orthopedic reject, and many, until today I still can't have a paper published there, perhaps one day. So it happens to all of us. Rejection is a journey. But it could be subtle, as this cartoon shows. Thank you for submitting your story to a magazine. To save time, we are including 2 rejection slips, one for this story and one for the next one. So it could be, sometimes I'm sure received the comments from the editors or reviewers could be rather sarcastic, right? I received quite a number of them. Nonetheless, don't give up. We all need to make mistakes in order to progress, and that is important. And wise man Yoda, who advises, the greatest teacher failure is. Meaning, failure is our greatest teacher, isn't it? Right? A wise man from Yoda. And there's a book, and this is one of the very good books, I'm not sure you read. The management people, they go for workshops, courses. Feel the fear and do it anyway. Right? We need, for example, have you seen those parachute from the plane or helicopter, the Air Force, right? They are quite fearful, but they just feel it and just plunge, just jump. And that is a very good book. If you haven't read it, get hold of it and read. And interestingly, this week is exciting for us in academia. It's appropriate, the announcement of Nobel Prize winner. And this is from the chemistry, Mogi Bawendi is a co-winner of the chemistry, developing this quantum dot, which is making revolution, right, in medical with this quantum dot for diagnosis and therapy. Interesting, he mentioned he flunked his first exam when he entered Harvard University, the first year, his undergraduate. He said it nearly destroyed him, but nonetheless, he just won the Nobel Prize for Chemistry. It's interesting. And another really interesting story was from Drew Weissman. Most of us may have heard of him, right? And Kathleen Carrico, they contribute a lot to the mRNA, and that was a precursor to the development of COVID-19 vaccine. And before this, Drew Weissman is immunologist, is MD, PhD. He gave a speech to the doctors in one university. See, the person who achieved his goal is the one that has faced frustration and dealt with it, understood it, and used it to their advantage. We repeatedly fell, were knocked down, ignored. We kept getting up, and we didn't give up. It's very encouraging, inspirational. So basically, he wished the graduate class of the 2021 a lifetime of frustration. Imagine someone, I wish you have a lifetime frustration. But there is reality, and both of them won the Nobel Prize this year for physiology and medicine. Right? So the great lessons, inspiration for us is timely. So learn, not just learn to pass exam as our education system, how many A's for SPM and so on, or graduate with first class, second class honors, but with a purpose. This is an example about learning. We talk about lifelong learning. We really want to fulfill our potential with us. Besides academic, there are other aspects as well. And notice this cartoon from these two, Barbara Bray and Kathleen McCluskey, making a difference. Right? You can see that. So we want to solve a problem, contribute to a world in some way beyond our academic achievement, and also discovery. Right? So it's from teacher center, we teach them, and we are moving away from learner center to learner driven, right? Where how they want to learn. And many of, noticed we have the curriculum changes about our learning, we are moving to that direction, right? That is excellent. And New Yorker is one of the very old, I enjoy watching, reading the cover and reading some articles. It's a long, it's an American humorous magazine. Interesting. Just look at the cover, you learn a lot. This is pretty old, in the 50s and 60s, making fun in a way of the American military. They've been all over the world, and see what, assess our environment, know where we are, our system. You look at that, how the tank, or they're just navigating a small street in Europe, just got stuck there. And ask for direction, like you're lost, stop by like again, probably they are somewhere again in the military exercises, got lost. And also important, confront obstacles. What do they do, right? When the cartoon illustrates, tell us a very nice story, right? You have the modern, those days, like 1950, 60, all the tanks, and they were stuck. A herd of cows were just walking slowly in front of them. So think of our situation in our academic career, doing research, or students who are studying or completing a PhD, or you're going up the rank from lecturer, associate prof to full prof. There are situations we need to assess. I always have this for my own PhD students. The journey you start, right? You fall down, you stuck with a problem, can be months or years, and then you pick up. Remember the Nobel winners, the chemistry and the physiology were telling us, don't give up, keep on, and then just dash for the final. It's something of that way. So this learning leading to growth with the purpose. And I'd like to quote one, John Maxwell, you might have, is one of the great motivators in the United States and internationally. If you're focused on goals, you may hit goals, but it doesn't guarantee growth. If you focus on growth, you will grow and always hit goals. Goals is something we set, right? Once we reach it, we're happy. Let's say, oh, we want to get $500,000 ringgit grant, or want to publish 3 papers in a year. These are goals. It's good to set, but we need to grow, have the purpose why we grow, and grow is, there's no limit. Right? And once you achieve our goal, let's say our grant, we might be happy or complacent. But you think of growth, and you keep on developing yourself, keep on pushing yourself, and this is very important. And this is intentional growth, right? Not like we keep on going taller, fatter, or older, right? But it's growth with a purpose. And there are some good tips. This is from him. It's a book called Beyond Success. John Maxwell is a good motivator. Make growth itself your goal. Our goal is to want to grow, and set that. And learn something new every day. And that's very important. We must be curious to learn, to acquire knowledge. Intentionally plan your growth. Don't let it happen. Grow, like we eat, we exercise, but intentionally we have something in mind, what we want. So this is the personal growth that is important. Of course, today we'll talk about lifelong learning and all those. the passion. And there's a good reason why the University of Malaya, in all the wisdom, finally we settle on these points. Right? The first one is passion, very important. So we use passions to find the purpose in life, in what we are doing in the academia. And the Japanese have a great philosophy called Ikigai. Interestingly, this is in their official website, japan.go.jp. This is their official, the nation's Ikigai. This is something like the national philosophy. Basically, in the French is raison d'être, right? The reason for being, the reason why we are here, why we are alive, why we are in university, why we're serving. And that is interesting. Look at that illustration. The Ikigai encompasses what we love, what is our passion, what the world needs, what you can do for them, what you can be paid for. Right? Of course, we need to have the award remuneration. Some aim for more, some less. Some we don't need, and what you are good at, our talents, our values. So that is interesting. And all you can see the intersection, which is a Ikigai. Right? It's an interesting philosophy. And I know that some universities are beginning to use this philosophy to develop the university, to plan for their vision and mission as well. You remember many years ago, right? We adopted the Japanese philosophy as well. Okay? We have many of the training, we go for that. The look is policy. And losing ourselves in the work is something interesting. Right? You look at this is from The Economist, a very good magazine quite a while ago. The gardener, the miner, right? They just enjoy what they're doing. We might think they're lowly jobs, but they enjoy, they know they're passionate. And how about us? Most of us are in the academicians. We are very, very fortunate. Huh? We are paid to what we like to do, isn't it? And besides, I'm more related to those in the sciences. Like they enjoy looking at the plants. They just study plants and they pay for that. Or those in the social sciences, right? They write poetry, books, literature, right? They enjoy and then they pay for that. Right? That is unique about being academicians. And these people too find life purpose and their passion, right? From the musician, painter, writer, to the scientist, right? And many more. Okay? They are great people, but ordinary people too, they have purpose and passion. Right? So in that way, the world is very competitive, so we need to set priorities. We all know about this, right? In the banking, we want to have priority banking. You travel, some of us are fortunate by business class with a priority, right? Departure or some lanes, priority checkout, right? For senior, for women, or even post laju priority. So we all want that. Everything is rushed, and the society is such that there are a lot of distractions from achieving our goals, right? So we need to set priority. And one you might know, or if not, it's good to know, to learn 80-20 rule. This is called Pareto principle. That means 80% of success will come from 20% of our actions. So we need to identify what these 20% actions are and work on them, right? Knowing that there's so many distractions. Most of us are bogged down. Administrative works, applying for grants and teaching, all the forms. So it is very important. So Joseph Juran is one of the management guru. You generally spend 80% of the time on 20% of the project. So that means the top 20% of our tasks. So in terms of research, right, how we can devote the time, it is important. Which are the more important? So we set the priority to do that. So we devote, we know that it will accomplish something, so we want to achieve that with 80% of the time. So this is a general principle. It works. Those of you are in the management would definitely know it, but practice is important, right, to put into practice. So John Maxwell, from his book, he gives these few steps. Keep a journey of your time, not just a diary or journal. It's important. Many top management leaders, they do that. List things you do well, percentage of time you spend doing this, right? Following that Pareto principle. and make today the best you possibly can. Right? That's important. Every day, don't think about yesterday's over, can't do anything or future, but what we can do today, right, to learn something new. And we need mentor. We all of us, young and old, even me as well. The leaders, all of you be leaders, to be dedicated, energetic, creative, passionate, and able future. And we need mentors to guide, to inspire and nurture. This is important. So I have fortunate when I was in University of Wisconsin in Madison. I spent about 2 years there as a scientist. John Cameron, you might heard of him, is the bone densitometer, right, for osteoporosis. He's the inventor of that and many other things. So I learned a lot from him. And here's one saying: if anything is worth doing, it's worth doing badly. Quite contradictory. He was citing G.K. Chesterton, an Englishman, writer. Basically, what I mean that you don't wait for perfection. And one of the biggest problems a student faces, you want to perfect. They're not published and they ever experiment to perfect. So slow down. But as long as it's work, just go for that. And Nike uses this, right? Just do it. Right? Just do it. And once you work, and then you can perfect it, fine-tune it later. Okay? This is a very good advice. So I started this global leadership and mentoring program from Latin America, Asia, Africa, and Middle East as well. So basically encourage them to grow, to learn. So it's been doing pretty well. I get different people, not only physics, but from psychology, from management, others to mentor them. It is a very good model. Hope we can do that in medicine. So finally, making a difference. How we can do that? Go back to these are the young people, the Greta and Malala. They all make difference. They continue to make a difference. Although they are young, but it's a good example for us. Remember, this is the from Harry Potter. This Dumbledore say, "It's our choice that show what we truly are, far more than abilities." So we have lots of abilities, of talents, and good researchers, but it is a choice if we want to make a difference, right? And no one can force us to do that. And there are a lot of grand challenges we can be involved with. We can have impact to the world. The UN wants to do that, and they're tackling this SDG. There's different goals with that. Okay? And recently I was in the UN headquarters in Vienna, August, just 2 months ago, various aspects of the SDGs. So we need interdisciplinary research. And this is a message that when I received my medical award, giving my acceptance speech, set your eyes on your aspirations and be courageous, even if the path is turbulent, adapt to change, but always be a person of integrity. Change is important. You want to make a difference to change. And the task for us here is really to enable it, not to foresee what people think, right? AI going to change if you lose a job or whatever, but we do something about it, right? To enable it, from The Little Prince by Antoine Saint-Exupéry. So finally, this is the message that I hope can take home with you. To achieve more, we should imagine together and change. Notice that change is very important, right? From learning, growth, right? To cross over from the comfort zone to all the fear surrounding us, to change and make a difference. This is what we should be doing. However, the academic is very competitive, right? Some of us may not like it. I know some have resigned, some very good colleagues of mine. Just get out of it, right? There are others. Yeah. And you don't care about being public, just go fishing, and that is the wisdom of that. Okay? So be happy. Thank you.
Wow, that was such an interesting talk. Thank you very much, the esteemed Professor Ng. So, a part of appreciation, I would like to invite Professor Humarani to give a token of appreciation to Professor Ng. please give a round of applause to our esteemed Professor Ng. Thank you very much. So please stay back. So we're going to commence with our closing ceremony very soon.
Hi, good morning, ladies and gentlemen. So thank you for joining us at the Research Appreciation and Awards Ceremony in conjunction with the 2023 Health Academia Month and Research Carnival.
I need to get the slide up first. You open the slide, I get the mic. Or is it down here?
So we would like to invite all guests to be seated as our ceremony will begin shortly. Please turn your phones into silent mode throughout the event. So we'll be back when the event starts. Thank you very much.
Test. Test.
Ladies and gentlemen, announcing the arrival of our guest of honor, Yang Berbahagia Datuk Mahmud American and Yang Berbahagia Datin Ragaya Datuk Dr. Haji Ahmad Muhammad Yusof, patrons of the Mahmud American Medical Research Grant. Yang Berusaha Professor Dr. April Kamila Roslani, Dean of Faculty of Medicine. Yang Berbahagia Datuk Ahmad Nasri bin Muhammad, UMSC Specialist Center. Yang Berusaha Madam Nur Zaitun Sanusi, Chief Executive Officer of UM Specialist Center. Members of UMSC Senior Management Team, Management of the Faculty of Medicine, the Faculty of Dentistry and the Faculty of Pharmacy, Heads of Departments, esteemed colleagues, ladies and gentlemen. Thank you. Please have a seat.
Assalamualaikum and good morning, ladies and gentlemen. Welcome to the Research Appreciation and Award Ceremony in conjunction with the 2023 Health Academia Month and Research Carnival closing ceremony. We would like to extend our warmest welcome to our guest of honours, Yang Berbahagia Datuk Mahmud American and Yang Berbahagia Datin Regaya Datuk Dr. Haji Muhammad Yusof, patrons of the Mahmud American Medical Research Grant. Yang Berusaha Professor Dr. April Kamila Roslani, Dean, Faculty of Medicine. Yang Berbahagia Datuk Ahmad Nazri bin Abdullah, Director of UMSC. Yang Berusaha Madam Nur Zaitun Sanusi, CEO of UMSC. Members of UMSC Senior Management, Management of the Faculty of Medicine, the Faculty of Dentistry, and the Faculty of Pharmacy. Head of departments, esteemed colleagues, and ladies and gentlemen. My name is Farid from Pharmacology Department.
And I'm Hui Min from Department of Primary Care Medicine. So it is our great pleasure to be standing here as the Masters of Ceremony of this exciting event today.
We are honored to have all of you here today to celebrate the achievements of our researchers and scholars and the success of the 2023 Health Academia Month and Research Carnival.
So without further ado, we would like to start our event today with a closing remark by the chair of the organizing committee for the 2023 Health Academia Month and Research Carnival, Dr. Krishna Murthy Ganesan. Please welcome Dr. Krishna.
Thank you, Dr. Hui Min and Dr. Farid. Yang Berbahagia Datuk Mahmud American and Yang Berbahagia Datin Rahaya Datuk Dr. Haji Muhammad Yusof, patrons the Mahmud American Medical Research Grant. Yang Berusaha Professor Dr. April Kamila Roslani, Dean Faculty of Medicine. Yang Berbahagia Datuk Ahmad Nazri bin Abdullah, Director Specialist Center. Yang Berusaha Madam Nur Zaitun Sanusi, Chief Executive Officer Specialist Center. Yang Berusaha Professor Zul from University Malaya Medical Center. Member of UMSC Senior Management, Management of the Faculty of Medicine, the Faculty of Dentistry, the Faculty of Pharmacy, Head of Department, esteemed colleagues, ladies and gentlemen. First of all, I would like to express my heartfelt gratitude to Prof. April and Prof. Sanjay for entrusting me with the opportunity to coordinate this year's carnival. It has been an incredible journey, and I am honored to stand before you today. Over the course of these 5 days, we have witnessed a remarkable array of programs and events, all made possible throughout the collaborative effort of our esteemed partners from Health, the Faculty of Medicine, the Faculty of Dentistry, the Faculty of Pharmacy, University Malaya Medical Center, and University Malaya Specialist Center. Their unwavering support and participations have truly enriched this carnival. I must emphasize this achievement is not the result of a single individual's effort, but a treatment to the incredible teamwork displayed by our dedicated staff members. For the past 3 months or more, they have poured their hearts and souls into making this research carnival a resounding success. Allow me to take a moment of acknowledgement each of our exceptional team leads who have played pivotal roles during the smooth executions of. I kindly ask that you stand when I call your name. Dr. Liu B. Fan, Deputy Chair. Puan Azlinda, Secretary. Puan Ng Haika, Treasurer. Associate Professor Dr. Retna Kavri, Lead Sponsorship. Mr. Mohammad Zamri Mustafa, Lead Logistic. Dr. Jamie Jacqueline, Lead Communication. Dr. Janet Tan Sui Ling and Dr. Chandrika, Lead Pharmacy Program. Dr. Chia Che Wei, Associate, Lead Dentistry Program. Associate Professor Dr. Jayanti, Lead Visibility. Dr. Aruna Chelvan Rajamanikam, Lead Best Poster Presentation Activity. Dr. Lee Wenchao, Lead Interdisciplinary Collaboration Activity. Dr. Muhammad Shafiq bin Hassan, Lead Content Developer. Puan Tibashini Nair, lead Recycle Kits Innovation Program. Dr. Lim Hui Min, lead Program Book. Dr. Ramakrishna, lead SPM Program. Dr. Zuraida, lead SPM Program. Associate Professor Dr. Azlina and Professor Dr. Fung Shin Hee, lead Postgraduate Career Fair. Dr. Lim Jasmine, lead Student Mobility Program. Miss Caroline Chin, lead Value Creation Program. Puan Atika, lead Blood Donation Campaign. Dr. Alex Pang, lead Pathology Program. Associate Professor Rusdi, lead Psychological Medicine Program. Dr. Mohammad Helmi, lead University Malaya Medical Center Program. Associate Professor Raja Rizal, lead University Malaya Specialist Center activity. Let's show our appreciation with a round of applause for our dedicated committee members and the delighted staff who worked tirelessly to make this event successful. I would like to extend my heartfelt thanks to each of your dedications and tireless effort making this carnival a reality. Your commitment to excellence is truly commendable. I also want to express my gratitude to our generous sponsors who have made this event even more vibrant. Thank you to Sensi Berhad, B Crops, High Tech Instruments, My Cyto Health, and Novatic Scientific for sponsoring the lunch talks, and the Fisher Scientific, Neoscience for sponsoring the booth. Special thanks go to Beta Life Sciences, Street Scientific, Johnson & Johnson, Apical Scientific, and University of Malaya Medical Center Clinical Investigation Center for their valuable in-kind sponsorship. In conclusion, I would like to offer my sincere apologies if at any point during this journey my actions may have inadvertently caused offense or inconveniences. Please know that I am committed to addressing my shortcomings that may have arisen during this carnival. Once again, thank you all for your incredible dedication, support, and contributions to making this research carnival a resounding success. Your hard work and commitment have not gone unnoticed, and I'm truly grateful for each and every one of you. With that, I sadly conclude the ceremony. Thank you very much.
Thank you, Dr. Krishna. We will kindly ask you to remain on stage because next it is time for the 2023 Health Research Carnival Poster Award. So for this, we have a video montage first apparently by the organizing committee. Thank you. So next, we have the 2023 Health Research Carnival Poster Award. So now we would like to call on stage Prof. Sanjay, Deputy Dean for Research, Faculty of Medicine, accompanied by Dr. Krishna, to present the award to the winners.
Okay, so the first consolation prize goes to next. Jessica Francis with the project Adaptation of Oral Hygiene Care Questionnaire for Nursing Caring for Geriatric Infections. The second consolation prize goes to Se Wen Kwan, whole mitochondrial genome sequencing of Malaysian patients with cardiomyopathy. Congratulations. The third consolation prize, Siti Nur Aliyah Zamri. The topic is accuracy of smartphone camera urine photo colorimetry as indicators of dehydration. So now the third prize goes to Ravi Chandrika with the title Implementation of a Comprehensive Unit-Based Safety Program for the Prevention of Central Line Associated Bloodstream Infection. Congratulations. The second prize goes to Nurul Amniya Azhar. The topic is FDFT1 mediates cisplatin resistance of bladder cancer, and it's targeted by, it's interesting, I'm sorry, 146B5. Now, let's announce the winner of the 2023 Scientific Poster Competition. The winner goes to Rufaida Othman. The title is Peripheral Blood-Derived Mesenchymal Stromal Cells, potential tool for cartilage regeneration and their combination of PRP. Congratulations to all the winners. So we thank Prof. Sanjay and Dr. Krishna.
Now we have come to the most anticipated moment for this event, the Research Appreciation and Awards Ceremony. The Faculty of Medicine, uniquely in provides 2 internal grants under the purview of the Research Office to our academic staff to pursue research in the health and medical sciences. These are the UMSC Care Fund Research Grant, abbreviated as UMSC-RG, and the Mahmud American Medical Research Grant, abbreviated as MMRG. After undergoing a rigorous evaluation process, this is the time for the successful applicants to enjoy the fruits of their labor.
Now, we would like to invite Professor Dr. Tan Ai Hui, who is the head of Research Management Unit in the Faculty of Medicine, to share with us a summary of both grant applications and chair the subsequent award ceremony. Please welcome Dr. Professor Tan Ai Hui.
Thank you very much, Farid and Hui Min. Our distinguished guests, our esteemed faculty members, our hardworking students, colleagues, friends, ladies and gentlemen, it gives me a great pleasure today to present to you about the UMSC Care Research Grant and the Mahmud American Research Grant. Behind the application and of each research grant, be it an internal grant, national grant, or international grant, there is a team of very dedicated people consisting of both academic and support staff who often work behind the scenes to ensure that we are able to help as many people to obtain funding for their research projects. On this occasion, we would like to start by thanking our UMSCRG and MMRG vetting committee members who have worked tirelessly over the past few months to roll out these grants. We have put their pictures here, and I would like to take this time to acknowledge Dr. Lim Hui Min, Dr. Farid Nazir, Prof. Vairavan, Prof. Chu Wan Yuan, Prof. Fong Xingyin, and importantly, our support staff, our grant officer, Ms. Wan Noor Shazana, and also Mrs. Tengku Maimuna. Importantly, we would also like to express our sincere gratitude to all our 98 reviewers who have taken time to provide not only their recommendations for these proposals, but also constructive input and suggestions to enhance all these research proposals at the Faculty of Medicine. We understand how Faculty of Medicine staff are always juggling constantly between multiple responsibilities at work. So thank you all for taking the time to walk this extra mile for us. We have received a total of 80 applications this year, with the highest number from the Department of Orthopedic, Obstetric and Gynecology and Medicine. Now, certainly, there are many good proposals, and here we must thank the reviewers again for helping us to shortlist these proposals. So it gives us great pleasure to now announce to you that we have a total of 15 successful proposals with a total funding of 700,000 ringgit Malaysia. 12 proposals will be funded by the UMSC Care Research Grant with a total of 550,000 ringgit Malaysia, while 3 proposals will be funded by the Mahmud American Research Grant with a total of 150,000 ringgit. As you can see in this slide, there is a large diversity of proposals being funded, as you can see by the departments they come from. And majority of the principal investigators are our young lecturers or early career researchers. Now, ladies and gentlemen, we come now to perhaps the most important moment of this ceremony, where really we would like to express our deepest appreciation to our funders and our management who have made all these research grants available at the Faculty of Medicine. We would like to firstly thank the UMSC Board of Directors and Senior Management for their support towards research at FOM. Today, we are honored with the presence of the Board of Directors, Prof. April, and also Dato Ahmad Nazri Abdullah, who are here with us today. And we also are honored with the presence of the UMSC Senior Management, the UMSC CEO, Madam Nur Zaitun, Technologist Talib Sabri, and also our UMSC Medical Director, Professor Hari Chandran. We also would like to express our gratitude to the UMSC Fund Committee led by Prof. Dr. April Kamila Ruslani for their excellent stewardship of the UMSC Fund. And imperatively, we would like to take this moment to recognize and appreciate the invaluable contributions by each of the 266 UMSC consultants at the Faculty of Medicine, the unsung heroes who work very hard towards the generation of the faculty's UMSC fund. We want to thank them for all their hard work and precious contribution to this fund that has made a difference in many researchers' career at the faculty over the years. The UMSC Care Research Grant at the Faculty of Medicine was conceptualized in 2017. We are now into the 6 years, and you can imagine the batch of researchers, early career researchers who have benefited immensely from these grants to start up their research career. So again, we would like to thank all the UMSC Care UMSC consultants for all this hard work, for the sincere contribution to this fund. So here, it gives us great pleasure to now invite the UMSC Board of Directors, Dato Ahmad Nasri Abdullah, up the stage to present the UMSC Care Research Grant Awards together with our Dean, Professor Dr. April Camilla Roslani, and also the UMSC CEO, Madam Nozaitun Sanusi.
So when the winner is announced, we invite the principal investigator and the co-investigators to come on stage to receive the grant award. So the first recipient of EMSC RG1 goes to Dr. Amber Sahib from Department of Orthopedic. Her title is Functional Outcome of PEV versus PRP for treating plantar fasciitis among healthcare workers in a tertiary hospital. The second goes to Dr. Ki Boon Pin from Department of Biomedical Science with the title Gut Microbiota Diversity in Heart Failure. Congratulations to Dr. Ki and his team. Congratulations. The third UMSC RG is Dr. Lee Yu Kong from Department of Primary Care Medicine. His title is Developing and Pilot Testing and Implementation Intervention to Increase Colorectal Cancer Screening Uptake in People with a Family History of Colorectal Cancer. Please welcome his co-investigators as well. Congratulations. UMSC RG4, the recipient is Dr. Ajanta Sinia from Department of Pharmacology. Title is Investigating Bioengineered Exosomes Containing CRISPR-Cas9 for NXA1 silencing as a novel strategy for combating chemo resistance in CRC. Congratulations. UMSC RG5, Dr. Jaya Sakti Sanyasyaya from Department of Otorhinolaryngology. The title is Elucidating the Effect of Listening Level and Listening Habits on Vestibular and Balance Function among Young Headphone Users. Congratulations. The sixth UMSC grant recipient is Dr. Benedict Francis from Department of Psychological Medicine. His title is Development of a Novel Malaysian Browser Game-Based Therapy to Treat Adults with Depression. Welcome his team.
Congratulations. The recipient of UMSC RG7 goes to Dr. Kong Boon Hong from the Department of Molecular Medicine for the project entitled Investigation of the Effect of Lignosus rhinoceros TM02 on neutrophil extracellular traps, nets, and cytokine production in post-acute COVID-19 patients. For UMSC RG8 recipient goes to Dr. Kumuta Malar Velasamy from the Department of Medical Microbiology for the project entitled Characterization of Burkholderia pseudomallei phage genomes for therapeutic applications. The recipient of UMSC RG9 goes to Professor Dr. Zamri bin Sheikh from Department of Pharmacology for the project entitled A Novel Paclitaxel PEG-PHA Nanoparticle Formulation for the Treatment of Breast Cancer, Preparation, Psychochemical Characterization and In Vitro Efficacy Studies. The recipient of UMSC RG10 goes to Dr. Loh Kwong Weng from the Department of Orthopedic Surgery for the project entitled Immersive Virtual Reality IVR Simulation Training in Acetabular Fracture Fixation and Transfer of Scales to Cadaver Dissection, a randomized trial. The recipient of UMSC RG11 goes to Dr. Tan Han Ling from the Department of Orthopedic Surgery for the project entitled A Study Investigating the Effects of Platelet-Derived Extracellular Vesicles in Posterior Tibialis Tendon Dysfunction, a preliminary case control study. And last but not least, the recipient of UMSC RG12 goes to Associate Professor Dr. Sujaya Singh from the Department of Ophthalmology for the project entitled The Duration for Visual Acuity, Visual Field and Retinal Nerve Fiber Recovery Following Pituitary Endoscopic Decompression Surgery.
We would like to invite Prof. April to present our tokens of appreciation to Datuk Nazri and Madam Nozaitun for joining us in celebrating the success of all the UMSC Care Research Grant recipients this year. Let's give all the recipients a big round of applause again for their success. Thank you very much, Datuk Nazri and Madam Nozaitun. You can now return to your seats, Prof. April. We would like to request that you kindly remain on the stage for us for the next presentation. Ladies and gentlemen, we are indeed very privileged today to have the opportunity now to express our utmost gratitude to Datuk Mahmud Merican and Datin Ragaya Muhammad Yusof for their kindness, generosity, and support towards the research at Faculty of Medicine. Besides the Mahmud Merican Research Grant, Datuk Mahmud Merican and Datin Ragaya have contributed towards several philanthropy efforts at the Faculty of Medicine, including the renovation and the establishment of the Datuk Panglima Kinta Yusof Research Center. Datuk Mahmud and Datin Ragaya, I think the whole faculty stand to learn from your giving, your kindness, your passion, and your generosity. And we are very honored to now call upon both of you up here today to present the awards to the MMRG Research Grant winners.
So similarly, when the winner is announced, we invite the principal investigator and the co-researchers to come on stage to receive the grant award. So the recipient of the first MMRG research grant goes to Dr. Chew Ki Siang from the Department of Pediatrics for the project entitled Developing an Evidence-Based Malaysian Food-Based Dietary Guide for the Treatment of Inflammatory Bowel Disease in Children and Adolescents. The recipient of the second MMRG award goes to Dr. Teh Sok Kun from the Department of Pediatrics for the project entitled Study on the Acceptance of Prenatal Diagnosis for Congenital Anomalies and Selection of Reproductive Choices of Malaysian Women and Their Spouses. And last but not least, the recipient for the third MMRG award goes to Associate Professor Dr. Tan K. Yee from the Department of Molecular Medicine for his project entitled Investigating the Diagnostic Potential of Toxin-Specific Antibodies for the Detection of Malaysian Pit Viper Venom Antigens in Snake Bites.
we would like to invite Prof. April to present a token of appreciation to Dato and Datin for gracing our ceremony with their presence today. I would also like to request Prof. April and Dato and Datin to remain on stage as I pass the floor back to our MCs. Back to you, Hui Min and Farid.
Thank you very much, Associate Professor Dr. Tan Ai Hui. Now, for the icing on the cake, pun intended, what makes today's event more special is that we're very happy to share with you that today is actually Datuk Mahmud Merican's birthday.
So the Faculty of Medicine has prepared a small celebration for Datuk Mahmud Merican on his special day. So we would like to invite Prof. Sanjay, Dr. Krishna, and the member of the Faculty of Medicine Research Office to join the birthday celebration on stage. Let's sing happy birthday song.
Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you.
So thank you, Dato and Datin, and thank you everyone as well for joining us in celebrating Dato Mahmud Merican's 88th birthday this year. We wish for Dato to have a great year ahead with his family and be blessed with immaculate health, inshallah.
Okay, with that, we have reached the end of today's event. So we are now officially closing the curtains of the 2023 Health Academia Month and Research Carnival. On the behalf of the organizing committee, we would like to express our deepest gratitude to all the distinguished guests, speakers, and participants for making the Research Carnival a success.
So before we leave the hall, a few points for the audience to take note. Firstly, we welcome everyone to join the lunch prepared in Wing A of the TJ Danaraj Library. And to those who haven't managed to visit the posters and booths in Centre Point, please do so before they are taken down this afternoon. And secondly, there will be a group photography session after this event. So we kindly request for the organizing committee, as well as the recipients of the Poster Award, the UMSCRG Awards, and the MMRG Awards to stay back for the photography session.
Yeah, we hope to see you all again in next year's Research Carnival. Please continue to support us. Thank you very much, everyone. So now we would like to have a photography session for the Datuk Mahmud Merican Research Grant Award. We would like to welcome Prof. April, Datuk Mahmud and Datin Ragaya to be on stage, and together with all our three research recipients, award recipients. Thank you, everyone. Thank you, Dato and Datin. So next is a big group. We have all the UMSC Grant Award recipients to take photo with our Prof. April, Prof. Sanjay, Dato Nasri, and Madam Zaitun Sanusi, and Prof. Hari as well. Yeah, welcome, Prof. Dato Talib as well. All the team members, co-investigators, principal investigators, please come on the stage. Thank you very much. We would like to ask Prof. April, Prof. Sanjay, and Dr. Krishna to remain on stage. Next is the Poster Award recipients. Welcome all the Poster Awards recipients to be on stage. So all the Posters Awards recipients, please welcome on stage for a group photo. Yeah, the Poster Award recipients, please come forward. Poster Award recipients with Dr. Arun, please come on stage. So Dr. Arun, please join us for the photo session as well. Hi, the photographer. Prof. April? Okay, last but not least, all the Research Carnival committee members, please come on stage for our group photo.
All committee members, please come on stage, please.
So all the deputy deans, Prof. Yazid, come please join us. And the deputy deans from deans and deputy deans from dentistry and pharmacy.
All right. So we're going to have a two type of photo session here with the approval of Prof. April. So one from the front and one from the back. To highlight the logo.